Good afternoon. Want to call to order the June 15th, 2022 meeting of the Sacramento County Board of Supervisors. Again, welcome all who are in chambers to join with us this afternoon, and also those that are joining us remotely via the broadcast. And as we get started, we'd just note that we moved some items over from yesterday's agenda, and the clerk has very capably worked those into the agenda. And we had a closed session prior to this, and so we have a bit of a late start, but once we get into it, we'll get rolling here. So, Flo, I'll turn to you to make the announcements, to call the roll, establish a quorum, please.
Absolutely. Supervisor Cerna?
Here.
Kennedy?
Here.
Desmond?
Here.
Frost?
Here.
Natoli?
Here.
And you have a quorum. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T U-verse cable systems. The meeting is closed caption and is webcast at metro14live.saccounty.gov. Today's meeting will be repeated Sunday, June 19th at 8 p.m. on Channel 14. The Board of Supervisors fosters public engagement during the meeting and encourages public participation, civility, and use of courteous language. The Board does not condone the use of profanity, vulgar language, gestures, or other inappropriate behavior, including personal attacks or threats directed toward any meeting participant. In compliance with the directives of the county, state, and Centers for Disease Control and Prevention, the meeting will be live streamed and open to public attendance pursuant to health and safety guidelines. The practice of social distancing and wearing of face coverings, mask, or shield is recommended for the health and safety of all persons participating in person during the meeting, although it is not required. Seating is limited and available on a first-come, first-served basis. Members of the public will be given 3 minutes to make a public comment and are limited to making one comment per agenda item or off-agenda matter. Please be mindful of the public comment procedures to avoid being interrupted or disconnected while making your comment. To make a comment in person, please fill out a speaker request form and hand it to clerk staff. The chairperson will open public comments for each agenda item or call for off-agenda matters. And when the chairperson calls your name, please come to the podium and make your comment. To make a public comment by phone, dial 916-875-2500 and follow the prompts to be placed in queue for a specific agenda item or off-agenda matter. Please refer to the agenda or watch the meeting to follow along to determine when is the best time to call to be placed in queue to make your comment. Clerk staff will transfer calls into the meeting accordingly. Each agenda item queue will remain open until the public comment period is closed for that specific item. You may be on hold for up to an extended period of time, and your patience is appreciated. You may also send written comments by email to boardclerk@saccounty.gov. Your comment will be routed to the board and filed in the record. If you need an accommodation pursuant to the Americans with Disabilities Act or for medical or other reasons, please see clerk staff for assistance or contact the clerk's office at 916-874-5451, or you can send an email to boardclerk@saccounty.gov. Thank you in advance for your courtesy and understanding of the meeting procedures.
Great. Thank you, Flo. Today I'm going to do something a little unusual. I'm going to ask one of our audience members to lead us in the Pledge of Allegiance. I've talked to him previously, and I'd ask Dan Adderholt to please lead us in the Pledge of Allegiance. Dan, if you would, please.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Amen.
Thank you, Dan. Okay. Madam Clerk, do we have any items to continue? Otherwise, I know we can go to our off agenda. I think we have some folks in chambers, but we may have some folks on the phone as well. So.
Okay, yes. And you did make a note that about the continued items, and I'll just call them out. It was items 6, 7, and 8. Those were continued from June 14th to today. We also have 1 consent and 2 received and filed off-agenda items for your consideration. Pursuant to Government Code 54954.2b, there is a need to take immediate action on an item, and the need for action came to the attention of the Sacramento County subsequent to the posting of the agenda. Please first determine the necessity to hear the item before you take action on the matter. By consideration to take action, or I'm sorry, I'm getting confused with what I wrote. So let's determine the necessity to hear the item first, and then I'll need a motion to at least adopt the consent item.
Okay, so we have the 3 items as noted, off agenda, and 2 additional items. Do we have a motion to hear the items? Chair would move.
Second.
Okay, moved and seconded, then necessity here. Please vote. Okay.
Thank you.
All right.
Unanimous vote.
All right. Then you'll read those items in the record, please.
Yes, I
Yeah.
will. I'm asking for a motion to adopt the resolution authorizing continued remote teleconference meetings pursuant to Ralph M. Brown Act. I understand that the board adopted this on June 7th. We have a small gap. You are going to be on a 3-week recess, and so there's a small gap, and we need to continue with our boards and commissions so that they could do virtual meetings.
Okay. Do we have a motion on that item?
So moved.
Okay. Okay, moved and seconded. Any public comment on this item?
No.
Okay, please vote.
Unanimous vote.
All right.
The other 2 items, I'll just read into the record. These are received and filed, so no action is required. We have Supervisor Patrick Kennedy of the 2nd Supervisorial District traveled to Orange County, California on May 31, 2022 for the Sacramento County Be Well campus trip. Also, Supervisor Rich Desmond of the 3rd Supervisorial District traveled to Orange County May 31, 2022 for the County of Sacramento Be Well campus trip. And that concludes my notes for today.
Okay, we have those 2 items. We just need motion on those 2 items to receive and file. Or no, you
No, you don't need a motion.
Okay, you don't need a motion?
You're good on this one. And
Okay.
then I will note, too, that we do not have any public comment speakers in the queue on the phone
Okay, as of yet.
as of yet.
Okay, so, all right, with that then, we'll go to a time for items that are not on the agenda. We do have some speakers here in the audience today, so I'm going to call those forward. And we'll start with Dan Adderholt, followed by Dale Shook, followed by Tommy McKinney. And maybe you're all going to come forward at one time, so I can call you at once if you'd like. So, and John Fechner, Dorothy Richards, and Alexis Fonseca. And welcome. So, Dan, did everybody intend to speak, or you just have them here as a show of support? And if not, I'll give you a couple extra minutes if you'd like to.
They have something they want to say.
Oh, they
to
do?
you
Okay,
as well
good. So,
as
all
I
right. So,
do.
all right. Very good.
My Record Homes crew here are the regionals. They are the ones that have been claimed for 10 years almost with the American Rural Homes crew. There's Del Shook, Alexis, Rosa, Rodney, right? Right, yeah, Rosie, sorry. And Raymond.
Okay. Well, welcome. We're appreciative to have you here, and thank you for all your good work.
These are the men here that totally love the hell out of you guys.
Men
And I'll
and
be honest
women.
about that.
Men and women.
Huh?
You're men and women. You said the men. They're men and women.
Well, anyways, we totally appreciate all your support you guys have been giving us all these years, okay? And we're here today because we thought that they were being forced to move out today, okay? We thought the ordinance was going to go after us, and before my Record Homes got homes, and we talked down.
Right.
And I'm happy to hear that you guys are going to let my Record Homes crew have homes, but also we all of us strongly would like you guys to have some type of ordinance, you guys, where they have homes with their dogs, like with Section 8 or something for the Record Homes crews out here, because they all have dogs, and that is their family. We do not want them to be put to sleep. The shelters are flooded. There is no room for these animals, and none of the homes deserve their animals to be taken and killed. That is their family. That's who has been keeping them alive and safe all these years. So I'm hoping we can find a way around this. Even with those in shelters, they deserve to have a place for their animals as well. So I'm hoping you guys can come up with a way with that. But you, Phil Cerna, brother, I thank you personally from all my heart for being all your support all these years, man. You have been there. You have gave us. You got us and Park and Rec working together. And I thought that was never going to happen. I mean, honest with you, you got that going on, Phil Cerna. You got us trash bags when we had trash bags. You have been there for us, and we want to thank you for that. You've done something nobody's done. You have backed us and you believed in us.
The whole board has, Dan.
Exactly.
Yeah.
But you have been there, Phil Cerna. Don has been there. Even you, Des. Even you.
Rich.
You got a new nickname around here.
I had to pick on you for a minute, and man, Bruce, that's one quick retirement, buddy. That's got to be the record breaker there, man. I had to say it. Sorry, Bruce. But we just want to thank you, and they all want to talk to you as well. So I'm going to end it right here with me talking.
Okay.
I want you guys to hear from them.
Okay, great. Good. Thanks, Dan. Okay. Just
Hello,
Yeah.
thank you very much for having me, and I'd like to say thank you very much as well. And it's an unfortunate situation for me to be homeless right now, but I couldn't be homeless in a better place, really. American River is a beautiful spot, and since I've been there, I've been, being very appreciative of the stay there. So I keep my area clean and everything, and I've been doing that for quite a long time. Dan, we met up with him and we just started cleaning up together. But I was just doing that just because I was just thankful of, at least had like a tent over my head, instead of just being out in the street. And then being off the street, being by the river where you don't, I'm not really out in the public eye or anything, but, until they come out, you got to come out and enjoy yourself. But and American River is a beautiful place to enjoy yourself at, too. So I just wanted to say thank you very much, guys. And, I just hope that we can work a solution out that don't have us back, like chasing us around the city, if we're out of this area and then into this area. No, man, we need to get a really good solution on this right here. Thank you very much.
Great. Thank you for your work as well.
Hi, my name is John Beckner. I want to thank you for allowing me to speak.
Thank you, John.
It's a shame that we have the people that would want to remove us, because we do remove a lot of debris, and debris that most people don't, like the beaches down on the water where the geese are at constantly. I've moved a lot of debris from where I'm at, and even after I'm done working, I go out during the evening and I clean up areas, and I prevent a place where they see it's clean, but they don't know who did it. So it gives them a little initiation. It's a little discipline thing, and they start cleaning up. Now, we can't be responsible for everybody out there, but we do clean up after them, and when they move, and we remove them as much as we can. We don't like people out here to destroy our land. I was born and raised in Sacramento, Cali, and my grandfather was a great man here. He was one of the biggest concrete contractors. He had Marlboro. He saved people with the West Sacramento flood with his amphibious Jeep. When he came over here, he lived in an army surplus tent just across the river. He wound up owning 14 houses and wanted to put a lot of people to work. Did a lot of changing. I have a lot of ancestry that's helped a lot of people. And, well, to be honest with you, I wouldn't want to know where to go right now. I got there by chance. I didn't sign up for it, but I was in the Step Forward program. They had a bunch of kids running it. They put me out and put me there. But everything happens for a reason. And I feel that people need to take a note that people are out there trying to do the best they can, trying to survive. If it says we the people, it doesn't mean we the people have a house. We the people who have money. I've built monuments all over the United States of America. I built the first round fish ponds, the first concrete skate structure at Boca Raton. I worked all over a number of things. But one size does not fit all. When somebody goes crazy and they start a fire, like what happened the other morning, I didn't even know it happened. I don't even know the person. But then we put that and say, okay, you're all in that circle. No, we're not. I've worked all my life. I had open heart surgery just over a year and a half ago. And I'm out here doing my part. I think we need some type of caretaker like you have in the mountains. And that's what we kind of are, kind of caretakers. We keep us clean. I walk around at night and I pick things up. So that's all I got to say.
Thank you, John.
Thank you.
Thank you for sharing. Hi.
I'm Alexis Fonseca. I just want to say I'm kind of new to the whole river thing, but I actually wouldn't want to go anywhere else until I find a permanent home for myself. I do have an animal, and I was really hurt by what everyone was saying about putting them down because there was no place for them in the shelters or anything. And right now she's the only thing that kind of gets me going. To wake up and take care of her, and understand that what, we're going to get through this, and we're going to do it together. So that's kind of it.
Thank you, Alexis. Thank you, Alexis.
My name's Rosanna Williams, and it's hard for us out there, but we do what we can so that we can stay out there. We don't want to lose our animals. We love them. They're like our children. So we will continue to do what we can to help you like you help us. Thank you.
I'm just curious that we don't hear from the other speaker, but so is it sounds like for at least a couple of you that if there were some housing alternatives that allowed you to retain your pet, obviously, that would at least be a step in the right direction. Have you been, any of you been contacted by some of our navigators to talk about how, again, to accommodate, certainly, the animal is very important in your life, obviously, and, part of what motivates you beyond, obviously, the desire to, try to better the situation. So I guess I'm just curious, as we want to hear from other speakers, but Dan, you want to respond? Yeah.
I can respond to that because she's upset. We have talked to sheriff's navigators. We have talked to Hope. We have talked to numerous people through the years, like a revolving door. It's always they can't take their dog. There's no place for them to bring their dog. And one time there was a place, a triage shelter, and that got turned into a weed factory right after it was built, shortly after. But anyways, it's a shame because, like I told you earlier, Don, SHRA is willing to jump in and get homes for low-income housing with animals for the homeless with pets. They're willing to do that with you guys. They're ready. And I think that would be a real good play all the way for helping people and have the low-income housing built. Because, like you said, Don, not many people are taking the vouchers. But, you got buildings being built right now. So why can't they use those? Anyways, I just want to say I want her to talk now.
Yeah.
Mr.
Go ahead,
Chair,
Phil.
yeah, I was in the
Yeah.
queue here. So I too wanted to acknowledge the fact that from what I'm hearing, it sounds like as much as you may appreciate living in a beautiful setting, I think we'd all love to live on the American River because it's a unique part of the United States, not just our region. But as I think we all know, it's for all of us, and it's not designed for people to live on. And in fact, it can be very dangerous, as you probably know better than any of the five of us. Whether it's wildfires in the summer, or potential flooding in the winter, or just being exposed to the elements. Not to mention the fact that there are some bad actors, as you're probably all too aware, that can be violent at times. So I would just hope you have some very attentive people in this room right now, not just the five of us, but our very capable staff that are hearing what you're saying. And so, hold on, let me finish my thought, please. So I would sincerely hope that as much as you may enjoy the scenery and the camaraderie of living in a beautiful place, that's human nature. It's understandable. But I would hope that you would take advantage of any and all assistance that is extended your way. And we're taking mental notes too. We hear you loud and clear how important your beloved dogs are. I'm a dog lover too. I miss my Sadie. She's been gone for 11 years now, and loved her like one of my own. And so I get that. I understand it, and I sympathize. But we're responsible for you and your welfare and your health. That's our job, is to look out for the people that we represent. It makes no difference what your wealth is. Makes no difference what station in life you come from. We look at you the same as anyone else. We have a responsibility to you. So I would, again, just encourage you, take advantage of the moment, the audience that you have. And if there's a way we can accommodate both you and your beloved pets, we will bend over backwards to make it happen. We don't want to see the parkway destroyed because, again, it's not designed for people to live on, as much as you don't want to see it destroyed, because it is a beautiful public asset, not a private asset. So I just wanted to extend those thoughts following those that were shared by Chair Natoli, because I think this is an important moment for us as well as you. Thanks.
Yeah.
Can I say something really quick?
Sure, go ahead, Dan.
Bill Cerna, you know as well as I do that the American River Parkway didn't used to be beautiful, and that's why I formed the American River Homeless Crew, because Park Recreation had no money to clean it, and it was like maybe 6 to 10 feet high of trash from the bicycle path all the way into the water, all the way down to Old Sacramento on both sides, Garden Highway and Richard Boulevard side. Me and my American River Homeless Crews changed that. We cleaned the heck out of it every day and made it back into the beautiful place I thought it would be. I never got to see it be this beautiful. When I moved here, it was already thrashed. And we cleaned and saved it, and it's a beautiful place now. And we're fighting to keep it just as much as you guys are to beautiful. And none of my American River Homeless Crews, I want to make this clear right here, none of my American River Homeless Crews want to live on the American River Parkway. They want to leave, but they want to leave with their animals, not be taken away from their animals. They want to be in a home, not a shelter.
We hear that.
Yep, we got it.
And my crew members right here, right now, can tell you about the bottom of the heart, they all love you guys for what you guys have done for us. And that's why we took it so to the heart yesterday. And we thought we got blindsided by the Still Creek pictures, because we're the ones that were cleaning that Still Creek with Roland Brady years ago. And we're taking 15 to 20 tons of trash out a day out of that thing. What you guys saw was Pixie Plainland compared to what it looked like. That place was a disaster. We took 50 drum barrels. We had 9 50-drum barrels of needles we took out of that area of Still Creek. So we sympathize with you guys. We hate hoarders. We want nothing to do with them. No. And matter of fact, you guys can't go in homeless camps to remove these hoarding trash. We do. We don't have to abide by the laws you guys have to. We go in, we see a messy camp, we get on a case. If they don't clean it, we clean it for them. We don't put up with that. And Desmond, your area is next. Because we're coming towards you next.
Coming for you.
That right now. We've been told. We're coming to you next because we just got through doing the parkway. We're just finishing up. Friday here, we're having a May clean event. You guys welcome to come down. Please come down, you guys, Friday. We're going to be cleaning from 8 in the morning until 1 in the afternoon. Watch the finishing job of the parkway, you guys. Okay. And go look at our beautiful beach, Discovery Park, our beautiful beach. Okay. We're keeping it beautiful every day because we're fighting to keep it clean every day. We make sure. We've been finding tires, you name it. God, anything under the kitchen sink's been throwing that thing around River Park right there. And it irritates the hell out of me because worst case scenario is a kid getting hurt. That is the worst case scenario, or stepping on a needle, for crying out loud, like I told Don.
Right.
We're fighting to keep that from ever happening on the parkway. That's why I told you, I guarantee you there is no needles on the parkway. Not with my crews around, there won't be. We keep it clean and safe out there all the time for you guys, and we don't want nothing to happen. And Bill Cerna, we're ready to move, buddy. My crews are ready to move, but they are going to still be American River Homeless crews. They're still going to keep coming back to the American River Parkway, even when you guys get them homes. We all talked about this. We're a family. We came as one. And they'll all tell you, we love each other and we watch over each other like a hawk. And you talk about the crime there is no crime. Kennedy, you kind of irritated me yesterday. You kind of irritated me with that one because there is no crime on the parkway, buddy. I'll reiterate that with you one more time. There's no more crime on the parkway where we live, bud. Now, you talk about Rancho Cordova, all that area? Yeah.
No. I represent Rancho Cordova.
I'm talking about American River Parkway. There is no crime, buddy. We guarantee that, because that's all of us here.
Okay,
We're the
thanks,
only
Dan.
ones there.
Let's give
Anyways,
Dorothy a
thank
chance
you.
to talk here. Okay, go ahead. Good.
I've been on the parkway for a minute, and I was learning some of these other people, but long enough. And my animals are my family. One of them was abandoned on the parkway. She's 5 months old. And if I had found her, she would have died. And it's just like children. They want to be with their parents. The animals want to be with their parents, with their parents. And to separate us from our animals and put us in a shelter and put them in the pound and kill them, euthanize them, no, that's not going to happen because they are my family. No one is going to take them. And I am all they know. And that's not happening, sir. And I keep my area clean. I help with other areas. We all work together to keep that place clean. And you can't control what someone else does, whether they want to be a pig or not. But I don't tolerate pigs. Because anyone who knows me knows I will go get your stuff and take you to the street. Oh, well, you should have picked it up. I don't put up with pigs. I was raised that way. I live that way. I'm not out there because I want to be out there. I lost my job because I worked for a company that didn't give a crap. And I'm just a direct person.
Yep.
And to take my animals is cool to them, and that's the only home they've known.
Wait, do you have a couple dogs? Do you have dogs? Is that what you have? You said, I didn't hear what you said, your puppies?
I have dogs, sir, yes.
Yeah.
And they are my children. And I'm literally all they've known since they were puppies. And that's not fair. They're my life. I mean, I get up, I'll take care of them. They're what keep me going every day.
Yep.
Because I know that I've got to take care of them, and they take care of me in return.
Yeah, Mr. Sir.
And we want a shelter. We don't want a shelter. We want a home for us and our pets.
Okay. Thanks, Dorothy.
Thank you, and thank you all for
Thank you.
thank you all for
Thanks.
your words, Dan. We do have a really full agenda here today, so I know we have to get to the business at hand. But you heard me say yesterday, our office has provided a little bit of help for you in the past based on what you've requested in terms of materials that you need, tools, bags, whatever it is. So that offer stands. You just need to communicate with my office to make sure we understand what it is you need, and we'll get it to you. Dan, we're not going to do it here, so I don't want to
I
get
know
in a back and forth.
I know that. I know
yeah.
you pick on me about that.
But because we do have a lot to do this afternoon, but I just want to make sure you understand that offer is open because you do great work. We all appreciate the fact that you appreciate the Parkway as much, if not more, than the rest of us. So we want to make sure that you have what you need to continue doing the great work that you do.
It's paradise to us.
Yeah. Did you want to add something, sir? Oh, yeah. Okay, real quick, Dan. Yeah, I'll let you give
Can I
you.
just add one thing really quick, Don?
Yeah, very quick, yeah.
One thing really quick. One thing we definitely need more than anything right now, you guys, which I was going to talk about, I was going to send you an email, but one thing we need more than anything right now is water.
Okay.
Water and a porta potty. There is no porta potty on the Parkway on Richard Boulevard side, none, zilch.
Okay.
Somebody in a white truck stole it. Anyways, thank you.
Okay, thanks, Dan. Go ahead, sir. Yeah.
I just wanted to mention that you talk about cleaning up the Parkway. We clean up a lot of stuff that people don't see. And talk about saving the Parkway and making an impact. That's what we do. We clean up a lot of things that people don't see. That's underneath the dirt, underneath the plants grow. I'm 62 years old, and I pay very close attention. I lived there in West Sacramento. I used to come all the way over here. I used to fish on the riverbank. We used to have a bonfire and fish, and now you can't do that anymore. But we clean a lot, and therefore, I think we do a little bit better job than what's visualized.
Okay.
Thank
Well, we thank all of you, and I guess I would just add to what Supervisor Cerna said that, one, I've heard with great sincerity your interest, obviously, certainly in what you do every day to help make the Parkway a cleaner place. But you're also interested in having permanent housing, and you want to be able to bring your pets with you. And if that's the barrier, then I would just say that I think it's incumbent upon us to figure that out. And I know and again, I would just look to Ann here for just a moment, but I think we recognize that the pets, sometimes partners, they use the 3 Ps, the possessions, but certainly the pets. And again, I think everyone up here is a pet lover, probably a pet owner, and they're important to us. So wherever you are in your lives, their support and they're tremendously loyal, and they're always there. And so, if as a part of our consideration, as we're looking to try to help you and others, I would even go as far as suggest that we have a policy by this board that if we help relocate folks, that their pets will not be destroyed or killed, that we just take it right up front, that, we make every effort to find another home or to have those pets stay with them in a situation, because I think that if that's the barrier to folks like we've heard here from today, for them to accept an offer, or at least consider an offer of housing, something that would meet their needs, but also that of, their pets, then I think that's what we need to not only just strive for. We got to make it clear. So there's no fear about somebody taking your pet and killing it. I mean, I know Claudia spoke to that yesterday. Certainly several of you spoke to that what you heard yesterday, somehow you derived that we were going to force people off the Parkway and take your pets and euthanize them, kill them. That's the farthest thing from anything we were talking about. But and you might be able to offer some reassurance. I would turn to you for a moment here. So,
yeah, I do want to reiterate
Yeah.
what you just said, Supervisor Natoli. There's never our intention to take someone's pet away and euthanize it. It is like, I can't even imagine that.
But even more so, I
go.
mean, the safe stay paradigm that we've now embarked by design, the way I understand it, not just for the first, but for all safe stays in the future, is going to have a kennel component to it, is it not?
Yes, so everything we're working on right now that's new we are taking the importance of pets into consideration so that when folks do come, you can come with your pets. We know how important that is. We know that very often your pets are the only thing, as you said, they keep you going, and it's your companion, and we absolutely understand the importance of that and are doing everything we can to ensure that if we do find either a shelter or a permanent home, that you're able to take your pets.
And I would just say, we don't want to break up the crew, because obviously you got a good working relationship, but we could find you all housing this very afternoon for you and your pets. I think it'd be the greatest thing we could achieve, so you and a whole lot of other folks. So again, I heard your commitment that as much as you love living and working out in the Parkway, that to every person I heard that you were certainly willing to accept housing, obviously with some caveats. And again, I think that's what we need to keep working on, as Ann said. So anyway, thank you for what you do. Thanks for being here. At least it's cooler inside than it is outside working in the Parkway today, so you got a good spot to be. But we welcome you, and we thank you for your efforts. And we've got folks here in the audience. Hopefully, Dan, I have the sign-in sheets, but ways to reach you, because I think you've all made some pretty powerful comments here today. We certainly take them to heart. We thank you, but also we want to help you. And again, we don't want to break the crew up, but if we could find you all housing this afternoon, you'd have to come back in another capacity, but I'm sure you would, because it sounds like you're very committed to what you do. So anyway,
look forward to issuing the proclamation. I know we have something on the calendar to express our appreciation more formally, so you'll be seeing that soon.
Well, act surprised.
Yeah.
Thank you, Dan. And
All right.
thanks to each and every one of you. Take care.
Great. No,
Okay.
that's clear.
Yeah,
Thank you.
That's good. We know you're committed. Thank you so much.
Thank you.
Very good. Very quickly, Dan, we got a very full agenda.
Here's the lady from Discovery Park that's been keeping your guys' beaches clean.
Okay.
Her name's Elizabeth.
Hi, Elizabeth. Well, welcome. We just heard from the rest of the crew, so you're batting cleanup here now. So go ahead.
Okay. Sorry. Hi. How you guys doing?
I know you just walked in, so welcome. Good afternoon, and
I guess I've been. I really don't know. I mean, I help clean up. I guess every day. I just walked in. I really don't.
Yeah.
Well, we thank you for your efforts.
I don't mind doing it.
Yeah.
I've been living there for like 5 years. Well, I know you're not supposed to live there, but I've been there for like 5 years, and I know it gets like, for all the homeless, there are a lot of people out there who just don't care about the river or don't care where they sleep. I do. I like to keep my camp clean. I have a lot of dogs. So, and the rangers and the dogs, it gets kind of, so just cleaning up, just keeping it clean makes the rangers like not be all weird, and then you guys won't be all weird on us. So I don't know.
Well, what I think you may have missed, because you came later, Liz, is the fact that our with our appreciation for what you do in terms of keeping the Parkway clean, we certainly want to make sure that everyone understands our intent is to make sure you don't feel like you have to live on the Parkway either.
True.
Because it's, you feel like you don't have a place for your pets or for other reasons. Everyone deserves shelter, and everyone deserves the services that they need, despite people's place in life. So want to make sure that you didn't lose that message, because the others heard it earlier. But as the chair mentioned as you were walking in, if we can help you get out of the circumstance of being homeless on the Parkway as soon as today, we want to make every effort to see that happen.
Even if you guys do make it so I can get out the Parkway, I would still, I think, help clean up.
We heard that too. That's clear.
I would still do that, because I love doing it. I love helping people. I like helping the river. it just makes the park look better, just all the way around.
Right.
So-
And thank you for that. Thank you.
Thank you, Liz. And we have contact information for some of the folks, Dan, but if our folks wanted to follow up with any, we certainly have yours, but any of your crew in trying to assist with the housing, we got a couple phone numbers here so we can follow up with you. So, again, thank you all for making the effort. You guys be safe out there and take care. And we hope to find you housing soon. So,
Thank
thanks
you
so
all.
much. Thank you. Okay.
We have one caller.
Oh, we have a caller. So, thanks again. So we have one off-agenda caller.
Hi, caller. Please start with your comments. You have 3 minutes.
Good afternoon, supervisors. This is Dr. Kareen McIntosh Sacco. I'm a licensed psychologist in private practice. I'm a community mental health advocate. I am a member of the Sacramento County Mental Health Board, and I am calling in today. Well, I'm a resident of Supervisor 2, and I'm calling in today as my role of president of the Sacramento Valley Psychological Association. I wanted to let you and the rest of the Sacramento community know about a really exciting event that the Sacramento Valley Psychological Association is going to be hosting for our community. The world's hurting. Rates of depression and anxiety have been skyrocketing even before the pandemic, especially among young people. We could all use more joy. Now more than ever, we need to cultivate joy in our community through connection. And the Sacramento Valley Psychological Association, with the help of Wealth-Based Health, Supervisor Kennedy, and City Council Member Katie Valenzuela, plan to do just that. As a gift to our community, Sacramento Valley Psychological Association invites everyone to be our guest on Friday, June 24th at 6 o'clock at the Guild Theater for a screening of Mission Joy, Finding Happiness in Troubled Times. In this 90-minute documentary, we learn about the importance of cultivating a practice of joy for mental wellness. This is told through the friendship and spirit of the Dalai Lama and Archbishop Desmond Tutu. In their final joint mission, these self-described mischievous brothers give a master class in how to create joy in a world that was never easy for them. They offer neuroscience-backed wisdom to help each of us live with more joy despite circumstances. And following the screening, there'll be an opportunity to participate in a moderated discussion with Dr. Christy Higgins, Dr. Jonathan Porteous, and myself. Sacramento Valley Psychological Association offers this gift to our community in order to promote mental wellness during such stressful times. I'd like to extend invitations to each one of you supervisors as well as to whoever might be listening. You can go to sacramentovalleypsychologist.com to register for the event. You know, we're all hurting. I know especially you guys have been having some really difficult conversations and deliberations here. We're all trying to do the best we can in navigating these unprecedented times. And so Sacramento Valley Psychological Association is just wanting to give this gift to our community. Please know that you are seen and appreciated, and a big, big thank you to Supervisor Kennedy to help financially support this endeavor. Thank you.
Great. Thank you, Corinne. More joy is a good thing, so we certainly appreciate the invitation. Thank you to our colleague, and I know that I think we've also received a written invitation as well. So thank you so much. Thank you to the association, and hopefully a lot of folks will partake of the opportunity to learn more about how we can all get better together. So thanks, Corinne. Okay.
Okay, and that looks like that she was the only caller.
All right. Very good. So that concludes our off-agenda items. I had no one else in the chambers on off-agenda, so that'll take us into our regular agenda. And with that, if you'll call the first item, please.
Okay, item number 2 is the George Hills Annual Report.
Okay, I think Lisa's going to kick us off, and then Randy's going to come out. Go ahead, Lisa.
Right, so today your board will be hearing from Randy Rendig of George Hills Company for the George Hills Annual Report. As you know, George Hills serves as the contract claims administrator for handling all defense liability claims against the county. Its contract requires that it give an annual report to the board, so that is what is happening here today. And I'll turn it over to Randy.
Great, thanks, Lisa. Randy, good afternoon.
Good afternoon, Chairperson Natoli, members of the board. Start off with some, this is going to be a good report. Risk management had a very good year in 2021. start with something that I normally don't start with, and that is the subrogation program that the county in George Hills has. Last year, we returned to the county about little less than $300,000, if my math is right. Last fiscal year, we returned $760,000. And it cost the county $45,590 to recover that $760,000. So sometimes when you collect money, it's like, okay, but how much did it cost to get it? We think that's a pretty good return on investment, if you will, for returning money to the county.
And Randy, that was recovered how?
I'm sorry?
And how was that money recovered then?
Those are all cases where an individual, either individually or through their insurance company, has damaged county property, and our subrogation team then goes out and collects the money from an individual who either pays on a monthly basis until they pay it back, or we work out some kind of deal with them, the insurance carriers. So we've got a team of 2 people that do that full time, and as I say, I think they've demonstrated that.
So is
it's a
that
real
largely auto accidents where somebody runs into a facility of some sort?
It could be any kind of property that's damaged.
Okay.
Absolutely.
Okay.
Yep.
Good.
So I've got a couple slides as usual.
Sure.
Are they on the?
We'll get them up here in just a second. There we go.
There we go. So this is these slides you've seen before, many years, for those of you that have been here. You'll notice a pattern here, and that's over the last 3 fiscal years, our claims administration fees have gone down. It's interesting because the amount of dollars spent went down, but the percentage of the total amount of the program itself went up. Now, again, we're not talking dramatic amounts, 2%, 4%, 7%. But, we think we're getting a good bang. We're giving you a good bang for the buck in terms of the services that we perform to handle these claims. Attorney's fees and costs, same thing. $5.7 million 3 years ago, $4.2 million. It's 44% of the overall program. Claim payments, notice the last 3 years, 15 million, 30 million, almost 31 million, and then 4.6 million. And we've talked about it before. Shock losses are what cause those big numbers. And we have seen a dramatic decrease in those shock losses. I can tell you that next year, that 4.6 number is going to be a little bit higher, but it's going to be nowhere near the 2 previous years. And miscellaneous costs and fees, that's for auto appraisals, that sort of thing. So the total cost, again, is 100%, but a significant reduction in the overall cost last year. So that's how the individual items break down to create the total. These are increases or decreases. And again, as you will see, administration fees down 10% from the previous year. Attorney fees and costs, and these are all attorney's fees and costs. There's going to be a separate slide for the 4 panel firms, but $4.2 million, 4.757. So costs are going down. Claims are going down. So there is and you'll see that in a moment, there is a reason why these things are happening. Claim payments, 15 million, 30 million, down to 4.6 million. 85% decrease. That's a pretty healthy decrease. Again, miscellaneous fees and costs, small number. Whole thing down 74%. The assignments for the 4 panel firms we have. Again, these are distributed. We try and distribute these as evenly as we can. Some firms are bigger than others. Some have certain expertise that others don't. And so the bottom 3 firms are, similar in nature. Evans, Wykowski, and Ward, they handle most of our auto cases and other type of bodily injury cases. As you will see in the past, they kind of led the pack. There just weren't that many in this last fiscal year, which is why their number was down. So again, there's different factors that go into how we assign them, but we do try and keep it as much of a level playing field as we can. Here's the amount that we paid them for the last fiscal year. Again, a significant drop from 1819 to 1920 to 2021. So the total amount that I previously showed you for the total amount of the attorney's fees and costs was $4.236 million. Of that, $3.2 million was to the 4 firms. The reason there's a difference, there are conflicts that develop that we can't use our 4 panel firms for. There may be cases where the county's sued, individual employees are sued. There's a conflict because of the way the situation or the accident occurred, so we have to hire separate lawyers to represent the counties, represent the individuals as opposed to the county. So that's why there's this difference. Lawsuits closed. I remember last year saying that we will never see a 72% close without payment again. I think I also said it was usually around 55% in terms of where that number comes in. So we fell back in line this last fiscal year, 53%. There was no payment made on these litigated files. How they break out in terms of, it's changed a little bit. Sheriff is and has been for quite a number of years. I know Supervisor Cerna and I talked about that last year. But sometimes the other 3 categories change. The miscellaneous, that's 3 lawsuits or less. Non-jurisdictional. Non-jurisdictional is the county gets sued and the county didn't have anything to do with the loss. It happened in the city of Sac, but they sued the county anyway. Those type of situations where they just got the wrong folks. And typically what happens when they do that is rather than us sending them out to lawyers, the adjuster that's handling the case will call plaintiff's counsel and say, hey, listen, you got the wrong folks. How about you give us a dismissal? We'll give you a declaration saying it ain't us from the person most knowledgeable with the county. Works probably 50% of the time to where we don't have to get outside counsel involved. Another 25% of the time, they won't do it. We've got to send it to outside counsel. They'll pick up the phone, they'll call plaintiff's counsel, and they'll go, okay, get us the declaration, we'll let you go. And the other 25% roughly, we do have to hire, we've hired the lawyers, now they have to do some discovery, and they want to lock down either through depositions or some other means to make sure that the county isn't involved. So there is a good savings on not sending them all out to outside counsel every time. Yes, Supervisor.
Thanks, Randy. Yeah, Supervisor Cerna.
Thank you. While I appreciate that explanation, it raises other questions for me. It's a side of the, I guess, the art and science of settlement proceedings in the law that I didn't understand. So to someone that may just be watching today and hearing what you just said about just the fact that the wrong party, if I understand you correctly, the wrong party was identified. There seems to be there's like a separate cottage industry around just how you would let the other parties involved know it's the wrong party, and that can be as involved as having to pay attorney's fees and everything else that comes with just getting a declaration exercised?
The best example, I'm not sure it's that onerous of a process or that difficult of a process.
Well, that's my point.
Yeah. But we have no control over the lawyers that do this. And so for us to prevent that, there's no way we can prevent the filing of a lawsuit because anybody, as you know, can sue for anything. And so once they do that, they are sometimes protecting their practice by making sure that if they have a party in there that shouldn't be, or have a party in there that should be in there, but yet they've dismissed them, there's remedies for that. But there's no point in then keeping, on the other hand, a party in there that shouldn't be in there because it's ultimately probably going to cost them more money because now we've got an extra set of lawyers in there on the defense side that are challenging this. It's just much cleaner for everybody if they let the parties go that really should be in there in the first place. So.
No, I get it.
I can weigh in a little bit.
Please.
It's you're not always dealing with reasonable people, and also
What?
I know it's hard to believe, and also the lawyer has a duty to make sure that they're suing the right people and protecting their clients. So if they're not sure if it's on, let's just use the example of Florin and Power Inn. If it's on one side of the street, then it may be a county jurisdiction. If it's another, it might be in the city. I'm not sure if that's the right one,
not, but go
you know
ahead.
what I mean. Fruit Ridge? I don't know. Anyway, and so they have to do discovery to make sure that they're keeping in the correct party and dismissing the correct party, and that does sometimes take time. And so we may have hired an attorney to respond to that discovery, for instance, or again, if you're not dealing with a reasonable attorney, they may be trying to complicate matters. And so, the county would have to hire an attorney to then defend those types of cases as well.
So just for a non-lawyer, it sounds to me like it's a case of wide nets get cast, and then you have to kind of pay the price to free yourself.
Right.
Sometimes
exactly.
that's very true. And what we're seeing more and more often with these non-jurisdictional cases is the lawyers are we're seeing such an increase in Southern California lawyers practicing up here. And so when they see an accident in the city of Sacramento, they're going to sue the city, they're going to sue the county, because they both say Sacramento, because they don't know and they're too lazy to look and see what's going on, frankly.
And I see that too, because I review all the claims every day. Yeah, I review all the claims every day, and I laugh when I see it's happening on, 9th and J, and they're suing the county of Sacramento. So hopefully, again, Randy and his folks can explain that to an attorney, and they will say, "Oh, yes, great," but that doesn't always happen that way.
Like I said, this concept is something I was admittedly unaware of. It doesn't make me feel any better, but I appreciate the explanation. Thank you.
I mean, quite honestly, I had to ask Randy too, because I understand the concept, but I couldn't believe it amounted to, 15% of the costs? I mean, that seemed crazy to me as well.
Yeah.
So I acknowledge that.
Thanks.
Types of cases, other bodily injury, everything other than auto, slip and falls, excessive force cases, the run-of-the-mill, other than auto cases, 35% of the total. And then the others are negligible. The one surprising thing about this is the other personal injury, which are the employment cases. Usually that number is quite a bit higher. So there's less of those being filed, which is a surprise to me, frankly.
Not to me, but
We're getting better.
Well, and some of that attributable, though, that for nearly 2 years, a lot of folks weren't even in the workplace. I mean, they were working, a lot of folks were working remotely, so you had less foot traffic, certainly from an employee, but even from a customer service standpoint, we've gotten better at some of those transactional things being done. So again, I would think that might prevent a little less exposure, just because of, if you're having less people in buildings and that type of thing over time.
And quite frankly, Mr. Chair, I was laughing under my breath here, just because I would like to attribute some of this to just a better brand of leadership at the top of our administration, too.
Well, sure. That probably goes without saying, yeah.
I would like to think we do things better, the county does things better, the training's better. Yes, there's less employees. I mean, it's usually never one thing, of course. It's a myriad of things. So,
But we're better because we're doing better, so, okay, good. Thanks.
and finally, the total number of claims, you'll see a drop, again, not surprisingly, with COVID. The number of new dropped again. I would expect probably that will continue for another year. Who knows how long it may continue, but I think something in the 525 to 575 range may be the what we're going to see for the next couple of years. In your packet, but not there are no slides for the results of what Defense Counsel did in terms of closing files last year. Those are in your actual report. Any questions?
All right, thanks, Randy. Any other questions by board members? pretty concise report. All right, I don't see any additional questions. I don't have anybody signed up to speak. Anybody on the phone on this?
No, we do not have any calls.
Okay. Well, Randy, we thank you for being here again. So
You bet.
this will be the last time I'll be here to receive your report. So
What
next
I
year.
understand.
And appreciate your work over the years.
It was going to be my last time, too, but things have changed.
Okay. All right. See you on the other side.
Thanks,
okay,
Randy.
Great. Thanks, Randy. Okay. Just
Right. Item 3 is the report on COVID-19 response.
all righty. Dr. Kassiri and Siobhan Kathari, I believe. Good afternoon.
Good afternoon,
Doctor.
Mr. Chair and members of the board. I guess Siobhan is going to help me from the distance.
Role reversal.
I'm Dr. Olivia Kassiri, Public Health Officer. I have actually 2 reports for you today, one on COVID-19 and another on monkeypox. I do not have a PowerPoint presentation, so hopefully I'll be able to explain clearly the points that I want to put across. We did provide you with summaries, and so I'll be highlighting some of that information and also providing a little bit more detail on monkeypox, since that's a new disease that we're dealing with right now. So for COVID-19, we are continuing to see a little bit of an increase. There are some early indications of a slowdown, both at the Sacramento County level as well as at the state level. But of course, we have to continue monitoring to see what's going to happen. So from the update from last week, the case rate was at 37.3 per 100,000. We haven't gotten the update for today. I know we've received a few questions from some members of the public that have been very closely following our dashboard, because we put up information indicating that we were going to change the frequency at which we were updating some of the tabs. So for the one that most people are interested in, which is the cases and deaths, we are going to continue updating that on a weekly basis. But some of the others, such as the demographics, healthcare, lab, vaccination, and location, those will go to an update every other week, because right now, with the information that we have, people do know what the patterns are and what is happening. So we felt that being able to reduce the frequency will assist us in being able to free up our epidemiologists, who are now actually helping us with the monkeypox and also with other diseases that we have to follow, that we have actually had to put aside while we were working on COVID-19. So if there are any other questions, I think the most important one is the cases and deaths, and that will still continue on a weekly basis.
Okay. Dr. Kassiri, I have a question, but I think County Council punched that first, so I'll let
Sure.
Lisa.
Sorry to interject. I didn't notice the materials until right now. This was noticed as a COVID-19 update. So out of an abundance of caution, I would advise that we don't receive an update on monkeypox, because it wasn't properly noticed for that. If DHS has something that they'd like to share with the board, they could certainly do that in writing.
Or if a board member asks a question, they can respond generally.
Right. But again,
Be careful.
carefully, yeah.
Okay.
Just out of an abundance of caution.
All right. So just cut your presentation in half, Dr. Kassiri.
I guess I'll just answer
And I
questions
apologize
then.
for doing this, in the middle of your presentation,
Yeah.
but again, didn't realize that this was going to be discussed. So.
Yeah. If I could just on the COVID, because again, I actually had someone reach out to me yesterday afternoon late. I think they've been in communication, at least with some of your team, and they were seeking an explanation that you just offered, at least in brief here, relative to reporting data. This person outlined that they've been tracking the information because of their own personal situation relates to, and they were relying on the data to inform them about risk and just other community elements. This was supposed to be effective today, or it is effective today, that you're changing the reporting frequency. Is that
Let me check.
Because the party wrote to us yesterday late and said that the change goes into effect tomorrow, which is today now. So
That's correct, yes.
okay, so you're going to continue to report. The point that was made that there continues to be some surging, and in light of that, folks that are again trying to guard against some of the risk elements, but also understand them. And I understand your point about the epidemiologists and what they're tasked with. Is there any other components as a part of that beyond the deaths and hospitalizations that would be of better assist? I don't know if it's the vaccination rates, if it's cases in total report. I mean, again, just think about your dashboard and some of the things that are on there, recognizing that if it's going to be updated weekly, that there's a task involved in doing that, both assimilate information but also put it in. Is there any other things, Dr. Kasseri, that we haven't responded? This just came in, and I don't know if your team has responded to this particular party yet. Maybe other supervisors' offices have received similar communications, but this person happens to reside in Elk Grove and wrote to me as their supervisor. So.
Yes, we are going to respond. We got the email just before the meeting, so didn't have time to. But back to your question, the indicator that is changing the most right now is the cases and deaths, and that's why we're continuing that weekly. We also want to point out that for individuals that are using this to make decisions about risk, I think the most important thing is to remember that right now, yes, we are in a surge. So if you are going out in the public and you have a condition that puts you at risk, the most important thing you can do is make sure that you wear a mask and also make sure you're up to date on vaccinations. And also be careful about which places you choose to go to. If it's a place that tends to be crowded, you may need to make a different decision about that, or minimize the amount of time that you spend in crowded places.
Okay, so and you will be responding in writing again. I'm sorry if you just got this. We didn't get it till late yesterday afternoon, and it was just handed to me before I came down here today. So, okay.
Absolutely.
All right, very good. I appreciate that. So, Lisa, did you have something else, County Council? Yeah. If you okay. Any other member of the board on the COVID update?
Yeah, I just wanted to point out a few more points.
Oh, sure, go ahead.
Under vaccination, again, I want to point out this is a question that Supervisor Cerner had asked a couple of times about including more information on booster doses, which we have done. So when you look at that data, Sacramento County, it's about 71.6% of the total population has received at least one dose, 66 fully vaccinated, and about 58.8% of those eligible for booster are actually received their booster. So we're continuing to have our vaccination clinics, even though they are small, but there are people out there who are still interested in vaccinating, and so we are doing that.
Yeah, I'm sorry.
Go ahead.
Sorry to interrupt. So when you gave the percentage for those that are eligible, that have received, that have been boosted, that is first boost only?
Yes, this is for the first booster. It does not differentiate for those that get the second one, because the second one, it's only people 50 and over.
Right. Okay. Thank you.
And then lastly, just wanted to point out with the jails, we have been doing really well until most recent couple of weeks, where we've seen an increase in the number of individuals testing positive. Most of these are actually people who are coming in and they're identified during the process that they have for screening right after someone is booked. And so we are working very closely with the health services for the jails to make sure that they have all of all that they need in terms of testing equipment, so that they're able to continue screening. And also, of course, they do have access to treatment as well for those that do meet the criteria. And with that, I guess I'll take more questions, or if you have any questions about monkeypox, I can take those as well.
Thanks. There were some reports here in the last few weeks about expired test kits and expired vaccines, I believe both. I may be confusing that a bit, but is that becoming problematic because of either low participation at the vaccination clinics, or certainly the tests have a validation date or expiration date? I don't know if they actually become unreliable at that very day, but I'm just curious about that. And if so, from our perspective, again, some of that came to us obviously through state and federal sources, but we also, I think we put dollars forth to acquire some of that, at least as part of our participation. So I'm curious, Dr. Kassiri, has that been an issue here, or is it more at a state or federal level?
It has not been a big issue because we've tried to be real careful about how we handle the test kits. We only request from our allocation what we think we will need. We have had a few that reach the expiration, and then we have to go back to the state and federal government to give us guidance as to whether we're able to extend that expiration or if we have to get rid of them. Of course, for the vaccine, it's even tighter in terms of the regulations around being able to use vaccine. You can't use it beyond the expiration date unless you have gotten an extension from the federal government. And we have a protocol for how to dispose of any expired vaccine, but we've not had a lot of that because, as I said, we've been tracking how much we're using.
Well, thank you for your prudence in doing that, and making good use of the resources that are available to us, and certainly not coming up short, but also not overextending in a way that then is potentially wasteful, I guess. So just again, in a general sense, monkeypox has been reported, and I think last I saw five cases here in Sacramento County, and maybe more. But just generally, are there any heightened risk related to exposures? It's been reported on that largely folks have traveled to locations where there's some exposure to a more prevalent transmission, I guess. But so just, again, keeping with council's advice, maybe you could respond generally to that.
Sure.
Yeah.
Yes, that's correct. We have 5 confirmed cases in Sacramento County, and the information that we're giving to the public is that the risk remains low. And reason for that is that we have been able to work very closely with the individuals that have been identified and have done contact tracing, and been able to make sure that those that were close contacts are identified and get vaccination. The 5 individuals also have received treatment, and are doing well at home. They're all at home. Nobody's been hospitalized. I do want to point out, though, that there are a couple of things that have helped us in this investigation, one of which is that our public health lab is actually able to do the testing that is required. It's a PCR test that identifies the virus as an orthopox, and then we send it to CDC for confirmation. Sacramento County is has one of the few public health labs in California that is actually able to do this testing, and it helps us a lot in being able to get results, a quick turnaround on results. I also want to thank you all for the support you've given us with the public health clinic. Usually the clinic sees TB and STD patients, but in situations like this, we've actually been able to quickly schedule people to come in and get evaluated and tested, and also for vaccination as well. So I know that I've talked with several of you over the years about the importance of the clinic, and so again, wanted to thank you for that support. I also want to point out that we do anticipate that there will be additional cases, not so much from this cluster, but because, of course, people continue to travel to areas that do have cases. And so we remain vigilant. We continue to work with our healthcare providers, because usually that's the way that we first get notified about cases. So we have a very good network and communication, and work very closely with them. And I also, again, want to thank our staff who mobilized really quickly in being able to take care of this situation and reprioritize. Some of them had to be reprioritized from COVID to help us with the monkeypox outbreak.
But the pox is treatable. It's treatable as far as if someone contracts the disease.
So fortunately, one is that the disease that people are getting, the variant, I guess, that is circulating is mild. So the individuals so far have had mild disease, but of course there's always a concern that there might be someone who gets severe disease. There is a treatment. The short name of it is TPOXX. And it's an antiviral, and we're very fortunate, again, to have a collaboration with UC Davis that is able to work with us in making sure that the individuals identified get treated.
Okay, very good. Well, any other questions of Dr. Cake? All right.
And what I'll do is, whatever points I didn't cover for monkeypox, I will send a follow-up email to provide additional detail.
Thank you, Dr.
Thank
Kasuri.
you.
Really appreciate it. Thank you so much. Okay, everybody on phone? All right, no callers and no folks in chambers that have signed up on this item. So with that, that's just a update. And again, thank you to Dr. Kasuri and our public health team and all of our partners. Okay, let's go to our next item then.
Okay, item 4 is the report back on health and safety considerations relating to cannabis.
All right, who's going to lead us off? Ann?
We'll just make a couple of remarks. Thank you. When we last heard the item regarding the cannabis tax measure, at the end of that presentation, several of you asked for a presentation or a report back on the health and safety aspects of cannabis. And so today we have Lieutenant Jamin Martinez will begin. He's from the Sheriff's Department, and following that, Health Services will provide a presentation as well.
Very good. Okay, thank you. Yes, Mr. Cerny, I'm sorry.
Yeah, excuse me. Before we hear the presentation, I just want to at least preface this from my perspective. I think we all understand that there are going to be adverse health impacts from cannabis, and that's what we're going to hear today. I'm a little not surprised, but I guess hopeful that at some point we could hear from other experts, not necessarily law enforcement, but other health experts that might be able to educate us or expand on the growing body of research in terms of the medical benefits of cannabis. When we, as the CEO just said, this is a presentation on the impacts and aspects of this particular substance. Impacts and aspects run both ways. They can be adverse and they can be positive or beneficial. So I just want to make clear what the public and what the board is going to hear, I think, in the next several minutes is a bit one-sided. It's about I would say it's a presentation about the adverse impacts, and notably is absent any mention, at least judging by the PowerPoints that I've seen in advance of the potential benefits of medical cannabis. So,
okay, thank you, Mr. Stern. Supervisor Frost.
Oh, who would that be, Phil? Who would that be? And can we?
I don't think there's any shortage of experts out there.
I would be interested in that also, and I think it would be good to hear it before we vote. on
Yeah.
this item but I don't know who that would be. But I know that
I think
there
we
are
can
benefits.
probably arrange to find some people.
I certainly think we could probably do that for sure. I just want to make note that we have to vote on the tax ordinance on July 12th. So if we brought someone in to talk about the medical benefits of cannabis, it would have to be on July 12th, albeit before the vote on the ordinance.
Well, and just for clarification, and Supervisor Kennedy's in the queue, that the have to is if there's a decision by the board to want to move forward to a ballot measure that would encompass a proposal that would have a taxing a component to it to the November ballot. That's the have to. Other than that, there's really no driver behind this.
No, that's correct.
Yeah,
It's just that we have to have the ordinance in place in order to get it on the November
right,
ballot.
No, you're accurate. I just wanted to say this from
Thank you.
yeah, thanks.
Mr. Chair, before you hear from Mr. Kennedy and Mr. Desmond, I for one would be interested in having that added information. I think as Supervisor Frost has indicated, if necessary on that day. Sounds like it is necessary.
Okay. All right, we're going to add to the July 12th agenda. We're going into the evening. Okay, Supervisor Kennedy and then Supervisor Desmond.
Yeah, just to make the point, and we may not all agree on this point up here, but the tax issue and legalization of marijuana in any kind or cannabis of any kind are two separate issues. We can, choose to put a tax on the ballot without changing the county's policy toward cannabis.
Okay. All right, Supervisor Desmond.
That's exactly the only thing I was going to say as well, is that this presentation, and I agree, another presentation that talks about positive health aspects, to me, are more important to help inform what we might decide to do after a tax ordinance. And I don't view them as I view them as mutually exclusive things, really. So,
and if I could, no, and I acknowledge that and agree. I would add, though, that while we may be able to discern the differences from a policy perspective and even a legal one in terms of what goes on the ballot, what doesn't go on the ballot, I'm not so certain that members of the public who may choose to advocate in the meantime between today, what we're going to hear today, and July 12th, and perhaps on July 12th, understand the distinction. So I just want to make it a little more clear by way of asking for a presentation on the other part of this, which I think from a substantive standpoint and the totality of what this county decides to do about cannabis, if anything, deservedly should be balanced. And so we should hear what those positive aspects are.
Okay. All right, thank you, board members. Lieutenant Martinez, you're up. So you got a chance to hear a little of the dialogue, so a little warm-up for you.
No worries. I know this is a controversial subject, and I'm kind of in an interesting position here, but I would suggest to Mr. Cerna that I don't disagree. I'm not a medical expert by any means, so I can't speak to the positive medical benefits at all. But as you know, this is strictly a presentation on the totality of what we see locally, regionally, and on a national level. But to be clear, I'm representing the Sheriff's Department here, and I'm also the Bureau Commander for a HIDTA program, which is the high-intensity drug trafficking area. We focus primarily on, the bigger drugs, methamphetamine, cocaine, heroin, opioids, and fentanyl. Marijuana is really not something that is on our radar screen, but I will do my best today to talk about some of the issues. And to be clear, we're pretty neutral on this stance. The slides, I guess I'm in control. Is this the, okay, sorry. There we go. So this is data from Sacramento County Health and Human Services Division. I learned about this data actually in Fresno. I was in Fresno a few weeks ago talking about opioid response and enforcement and prevention. And down in Fresno, they advised me they had these studies that were kind of looking at community perceptions of narcotics and alcohol and some other harmful substances. What I found interesting down there was that for youth under the age of 18, marijuana was their number one concern. It's the same concern up here, alcohol being number two, just slightly lower. And then as you get older in life, it tends to dissipate. So we found that interesting, but it does show that we have at least a perspective from the younger generation that marijuana is one of their number one concerns.
But it doesn't dissipate, it looks like, at all for alcohol.
Right. You can see some trends. Like for me, I would see that the methamphetamine when you're 19 and 26. That's my world. That's the issue I have concern about.
Right.
So those are the things that we focus on. Slide here. This is from the International Academy of Science and Impact of Cannabis. They are an organization of doctors who work with our federal partners and provide various data about marijuana. They keep a medical library of peer-reviewed medical literature about cannabis that's available to the general public, so it's a great resource. The library contains about 35 plus categories of marijuana and cannabis: violence, suicide, PTSD, pediatric exposure, motor vehicle accidents, depression, autism, emergency visits. There's just a lot of data there to kind of go look at and collect. But this screenshot in particular is a peer-reviewed literature discussing some data points related to dispensaries, minors, and young adults. Here, both studies from 2017 and 19 suggest there's a higher propensity for young adults and minors where access to dispensaries is readily available. They tend to use it a little bit more. I'm not sure if that's shocking to anybody, but again, it's peer-reviewed. I thought it should be relevant to our conversation today. Again, continue on with what I'm referring to as Isaac, just as short. I know it's not the proper enunciation there, but that's what I'm going with. You have three screenshots of different studies. The top one, this slide represents different peer-reviewed studies. Between 2019 to June 2019, September of 2019, 700 medical dispensaries were studied. Just under 68% of those dispensaries failed to comply with laws regarding age limit signage, which is a concern. And about 35.3% of those broke the law by marking items that appealed to children in their businesses. The second study is from 2012, which is a study of about a little over 9,400 people between the ages of 15 and 26, essentially suggesting that consistent marijuana use during that time frame of your life leads to increased intimate partner violence. And that's something that obviously catches our attention on the law enforcement side. There are many other studies that also kind of go down this path. I realize this study is dated from 2012. It's 10-year-old data at this point. But if you start looking and going down that rabbit hole, you'll see other studies that are similar. The third study from 2013, again, another dated study, is suggesting that marijuana and vehicle accidents have a correlation. And this also is continued on through other studies. There's a recent one in June of 2021 that says very similar things. So those are things that obviously catch our attention.
Mr. Chair?
Yes.
If I could ask a question. If you could, thank you. So I guess under the second golden rod,
Sure.
the bar there, it says consistent marijuana use was related to an increased risk of intimate partner violence.
Right.
Related. So statistically, do you know if that means there was a direct causal relationship, or is it the fact that there are other factors that aren't mentioned here that could have been much more influencing on the connection, the relatedness between intimate partner violence, and it just so happens the marijuana use was kind of thrown in with the other influencers.
I see your point, and to your point, I think that's without having this entire document in front of me, I would suggest to you there probably are other factors that are correlated with almost any study.
Yeah.
And I'm sure this study would say something very similar.
Great, thank you for that.
This other slide here, this next slide, one I also found interesting, done here locally in the county of Sacramento by the Sacramento County Department of Health and Human Services. They surveyed about 11,000 clients in a program, and within that group that they surveyed, those under the age of 17, 86% of them reported marijuana as their primary substance abuse issue. To me, again, I did not know this. I found that very shocking, but it's a fairly consistent theme we're seeing not only in Fresno, and if you look at a national level, these slides are not included in there. That's a similar kind of response. Again, just recently in Sacramento County, May 13th, 2022, this was on the local news where a young fourth grader brought these to class. These are edibles. And this kind of goes to the point I had made reference to earlier about signage and appealing to young kids and the issue that we're going to have there, or could have there. And then you really, truly can't have a conversation, at least in my opinion, about the cannabis industry and without talking about the illegal side and the taxation issue, which are kind of they're compounding effects on all this conversation. So when you look at the legal dispensaries in the county, you have to kind of consider the illicit market. There are a ton of academic journals and peer-reviewed studies and related material that talk about the good and the bad of marijuana. From my experience, there's the in the field, what we see stuff, and then there's the academic version of these two things, and they often are competing interests. There is plenty of data from various academic sources, and this is just one of them, that is suggesting tax rates are not set terribly well, and they are a challenge. The bottom line being, if you're going to tax marijuana in anywhere, there's always going to be an illicit market that will exist, and typically it's going to be cheaper on the illicit market than it will on the taxable side. And that, unfortunately, in this state, as I'll get to in a little bit, is a significant number. This 2021 study by the Regional Science of Urban Economics Journal indicates that they observed a drop in property value by 3 to 4%, with homes within about a third of a mile of a dispensary. They also estimated that nuisance crimes increased by about 4.2 per 10,000 census tract residents. The thing about this study that I would note, while it is a fairly recent study, this is in Washington. Right? It does not correlate necessarily to Sacramento, California, but it was a study that seemed to be relevant to our discussion today. Here in the Journal of Quantitative Criminology from 2021, their analysts showed some evidence that opening a retail cannabis outlet is associated with an increase in crimes within the immediate area, specifically property crimes, violent crimes, and robbery. This same study goes on to articulate that robberies may be a part because marijuana is a cash-based business. And obviously, if you have cash and lots of cash, you're kind of a target for robbery to an extent. This is from the Journal of Criminal Justice. And using UCR data, again, this is going to be out of Oregon, but just for context here. Essentially, they're suggesting that legalization in Oregon led to an increase in most crime, violent and property crimes, and that this study noted that legalization of retail sales resulted in increased property crime. They go on further in the study to suggest that the legalization of marijuana has not had a crime-reducing effect, like they kind of had theorized or has long been believed. Again, just another sample, a recent sample. And I promise this is the last study I'll talk about. You're probably tired of me talking about studies, but they're important. I found this one to be oddly interesting. In 2019, this study saw a reduction in violent crime within a half a mile of a dispensary, but only in the median above median income neighborhoods. So that was interesting. I had never heard of that. I thought that was very intriguing. They also observed 13% fewer hard drug and alcohol-related crimes per month, but they did see an increase by 15% of vehicle burglaries within a half-mile radius of that same location. So conflicting data, but one I thought was interesting.
Mr. Chair?
Yes.
Thank you. And I wanted to chime in now because you prefaced it with this is your last mention of
Yes,
academic studies and journals and whatnot. But would you, and I say this not to challenge you at all, but would you agree that I can probably go to Cal State Sacramento this afternoon, go to the library, go to it used to be with the third floor when I was there, the journal stacks, and find an equal number of journal studies that go the other way?
To your point, sir, I would hope you would do that online, but yes. And this is the challenge that I was faced with, frankly. There are, and I've said this before, there are countless studies that are going back and forth. And I will conclude this by telling you just that more study is needed and that we have competing interests here.
Yeah. And
ultimately, it's a tough position for me to tell you crime is going to go up or going to go down.
Right. No, and I appreciate your candor. I just feel it needs to be said because, again, for the public's benefit who may be watching the presentation, they may be left with, well, it's the undisputed truth or facts or foregone conclusion that the highlighted sections of these various periodicals or journals that you cite is the unchallenged truth. So,
and I will do my best to refute what I've just told you here in a minute. So bear with me. So our next slide, these are recent headlines. Again, I thought they were pertinent because this is what I see at my level. This is the top article here from 2021, suggesting that the cannabis illegal market is about $8 billion a year annually in the state of California. And then the article from May of 2022 talking about the complexities of the taxation laws. And they are incredibly complex. Just reading the article was enough you basically need a spreadsheet and kind of have to figure this out. But these are the challenges that we face in this state, and this is the side of the illicit market, why it's so successful here, because it's taxed at a different rate. This recent article from June 3rd of 2022.
Excuse me, Lieutenant
Sorry.
Ross, I'm sorry.
I'm sorry.
Yeah.
I'm not sure, but it's my understanding that the state is the one who really benefits from the taxation, that we get, as a local jurisdiction, get 20% of the tax or something like that, or do you know?
I don't know those exact numbers, but I think you're in the right area.
And we bear the burden of the administration of all of it, so am I
Well,
correct
to an
in
extent,
that?
you will, if depending on how this looks at some point, right? You're going to have some sort of office that would create this, if that's what you're asking me. Like, there's going to be a cost associated with starting a new industry in the county.
So the marijuana, the retail outlet then pays tax to us and to the state, and
Yeah, I would frankly, I would highly encourage you to go to this, to at least these two links in particular, just to kind of read about what the dispensaries are saying and how crazy.
Don't go to the library. Use the web.
I'm hearing, I've hearing from friends who are CHP and who've been involved in the cannabis, that a lot of the, they call them legacy growers are not, the small little guys can't make it. It's the big, huge guys that are making it in the cannabis industry because they can, they have the numbers basically, and the little guy has to basically try to figure out, in many cases, struggling to stay alive because of the taxes.
There's a lot of red tape,
Yeah.
to be candid.
Thank you.
Okay, County Executives.
Yes, I just want to say that we do have David McPherson from HDL on the line who might be able to better answer that question.
Yeah, that'd be great.
You want to come back to it? Want to let Lieutenant finish his presentation, or you want to do it right now?
He's far more qualified than I am to talk about that exact issue, yes.
Okay, so we'll come back to it. So pin that issue, and we'll come back to that as you go through. Okay, great. Thanks, Dan.
And this is, again, if you recall the Journal from Quantitative Criminology discussing the concerns about cash-based businesses, this was a national headline article from June 3rd talking about the similar issues, if you will, about the marijuana being currently a cash-only business because they can't make federal deposits and the challenges that comes up with. And then in Washington State, again, they're having some violent crimes, robberies, and homicides as a result of that. Again, I'm only putting this out there as just data from a national level to consider. It's not a local issue. Because here is the flip side. This is recently done in March of 2022. The Sacramento County Cannabis Study, Comprehensive Cannabis Study, was published by the city of Sacramento. It's a 200-page plus report. There's a lot of data to intake within this report. I'm highlighting over the items that I thought were of interest to the board at the moment. The study noted that the cannabis industry has not had a negative effect on home prices, nor has crime increased near dispensaries. This is locally within our own region, a study done by the city of Sacramento. However, and again, I'm going back to this little bit of a theme here, when addressing underage youth concerns around dispensaries, the report states the balance of consumer demand, including among youth, continues to be met through illicit supply based on price and availability. We're talking about, again, that illegal illicit market that is very robust in the state. Later in the report, they indicated an increase in crime has not occurred, but that cannabis businesses remain an attractive target for thieves. Again, they're relating this around cash. In June 6th of 2022, the Sacramento Bee went over the same study. Similar results. The only thing that the Bee mentioned that I did not mention, and I mention it here, is that in 2021, the study observed that property values decreased by about $13 a square foot. They are also calling for more data, more studies, more information, but whether that's an anomaly or something related is unknown. And I was just made aware yesterday, and I've only read it briefly, the city of Santa Ana has done also a similar study to the one that Sacramento did. The data is very similar. That crime did not go up, and things seem to be normal. To give you some context, and this is kind of the issue that I think just has to be addressed when we talk about an illegal market and a legal market and a businesses that want to succeed. Within the CVC HIDA AOR, which is what I deal with, between 2019 and 21, there was over 60 million plants, illegal plants seized, 500,000 pounds that was illegally produced seized. That value at a very, very low level is about $8 billion. If you take that on an average, because I think the average gives you more context, not just a big number, that's about $2.8 billion a year. And again, that's a pretty low number. That's within the AOR of CVC HIDA, which is 14 counties. So that's kind of more of a regional look at this on the illegal illicit market.
Good.
Go ahead. Sorry.
That's illegal illicit market in areas where it's legal.
Yeah, it's a mixture, sure, yes.
Oh, thank you.
What I've learned recently in my time back with HIDA, and then as this marijuana issue is starting to kind of really grow, and I would just suggest that Siskiyou County has asked for a state of emergency over the marijuana issue up there, and the things I've learned in talking to them, the environmental justice, and we do see this here, is a significant issue. So what you have in front of you are pictures of various chemicals, rodenticides, debris, trash that is seen at the outdoor illegal grows. I would point to you in the lower left corner there is carbofuran, which is going to be kind of an issue. In the 2020 marijuana impact report that was most recently done, the 2022 is not done yet, so this is the most recent data that I have. Carbofuran was detected in 82% of outdoor grows. That's a significant, and you can look at the chart, it's a significant concern. It's deadly to wildlife, deadly to humans, and it's being used on these products. This is just a more of a summary of the environmental impacts, and this is data that I've kind of gone over with the EPA, but when you talk about what happens within the region, what we see, you have fire hazards, you have plastic, poisoning of animals, killing of animals. Again, I went over this already, but you have trash, debris, sanitation issues, all these things that go with an outdoor grow. And depending on where you are in this county, that can be a significant problem. And you will see these same issues within indoor grows as well. Some are done much better and much cleaner, and they're very well run. The professional ones that are legal, those are great. But the ones that are illegal tend to have a lot of these chemicals and toxic problems.
If I could just ask a question, again, certainly representing good portion of the southern part of the county, and I know that some of your the team's activities have focused in and around the delta, or certainly along the in some cases seasonal waterways. The Casimas usually goes dry, but areas that are adjacent to areas that are farmed or close to waterways. Are you finding again these pictures? They're not reflective of something in county.
These pictures are adjudicated cases that I felt free to use without causing any controversy.
Yeah. So I'm curious though, without again overstating or understating it, are you finding when you do, because we still participate in the camp program, I believe, and I think we just saw it on the agenda, yesterday or last week. But are we finding situations similar to this? Again, this, I don't want to get too far askance from the issue about some policy decision to place a matter on the ballot for taxation. But on the other hand, I think to some of the impacts that maybe you're seeing in the field that wouldn't come to our attention. We read about you garner 15,000 plants that were being, but what about it? Do you see the same type of activity here with stuff strewn and,
My very candid response is yes. The totality might be a little different, and the context might be different. Yeah. The issue, the very frank issue, is that we, the Sheriff's Office, and most law enforcement agencies in this region, this is not something we have ever really wrapped our head around, dealing with poisonous substances as a crime. Right? We do a lot of other things really well.
Right.
This is new for us, and this issue is becoming a significant issue up and down the state because the volume of the illicit market is now outside all over our state, and I am learning that. Yeah. Well, actually, you can't have that anymore. That's a federally restricted item. We never thought of these pesticides as in that context.
Right, you show up, you garner the plants, you might arrest the folks that are there for that activity, other activities, but you weren't going to look to the chemical that was sitting there on the shelf.
It was this kind of the unknown. We never thought about it in that aspect. We've been educated more and have realized we've kind of been missing this.
So when law enforcement responds, obviously either you've done an investigation or you may get tipped off. I know you do aerial surveys, and some of the folks have gotten pretty sophisticated at being able to hide that even with outdoor grows. But do you have somebody from environmental management with you, as a part of that, so that, again, as you're getting better about if you're going to cite reasons for either arrest or for illegal activity, I assume some of those things have federal, state, and or local, penalties associated with them. If nothing else, it helps you track them. So do you have those folks along with you, or do they come out to the site, or you take the plants, if people are still there, you've encountered them and whatever happens, and then a lot of times they scatter and you clean the place up, and the farmer or the property owner that was...
It's an interesting logistical challenge. Part of this is because some of these things happen quickly they happen quickly.
Right.
And so there is no, if for lack of a better term, there's no environmental expert that's attached to a HIDA team.
Okay.
And so we have to reach out or pre-plan if we can. But again, this is new. This is very new. I have reached out personally to the Department of Toxic Substance Control's Cal EPA. They understand our challenge. They're on board with us. But like everybody else, it's not a full-time position. It's call us when you need us. We might be able to be there. We may not be able to. It's an interesting dichotomy to kind of go through because, again, we're not trained on how to even deal with some of these chemicals. And then where do we store them? There's a lot of challenges with these things. It's a little bit more complicated than just the plant grows and we.
Yeah.
You know.
I would just say that I think it's an important component. Obviously you're bringing forth the information that you researched and boiled down for today's presentation, and certainly I'm appreciative of that. Others are as well, I'm sure. But just that activity again, we're talking about illicit activity. And sometimes major grows, other times maybe a lesser scale as it relates to the plants, but where we've got contaminants, toxic materials that are not even supposed to be used in the manner being used, let alone may not even be permissible in the state or in the United States. I don't know. And we're next to waterways, we're drainage and irrigation canals, places where people reside, where in a lot of cases, obviously, you interface with wildlife, environmentally sensitive areas I'm familiar with, certainly in District 5. And I guess I would, as a follow-on, I think certainly, your team is tasked with, a lot of responsibilities, and marijuana isn't the highest on the list, but I know we do have the CAMP program, and I think you get some other funding that supplements that. I think it's important because, again, that's part of the piece that as you said, may have been a bit subtle, but now you're recognizing the impacts and what that means, certainly to our general population, but certainly to our environment. I guess I'd be curious to know over time as you build some capacity and you have a better understanding, because even if you show up and there's nobody from an environmental organization that's there or agency, you folks are going to be able to identify it. Then I say, what do you do with it and how do you dispose of it? And I guess it goes to, before you arrived, if they were using those materials and applying them in, non-agronomic, applications, or we're not even, or just absolutely prohibited applications, and yet the farmer next door has regulated products for herbicides and pesticides and so forth, and registers with the ag commissioner and buys products that are, certainly approved and licensed and certified through state and federal agencies. It's a real contrast, because I know sometimes there's a great deal of trespass that's involved with those types of things as well. So I guess let me ask you a question. So beyond what you're learning, how do you see maybe going forward with respect to that particular, when you're out trying to?
I'll be very candid. I received some information yesterday from Cal EPA that I frankly think you would probably be very interested in. I'm not going to discuss it today because I am not that expert. Yeah. But in what I have read, it causes me some significant concern above and beyond what we're talking about today. But that has little to do with the legalized section of this conversation.
And we actually had someone, and Phil recalled this, a few years back, that came and showed us, not so much in the county, although there were referenced maybe one or two situations, but showed us in the forested lands and the federal lands, but certainly in our adjacent counties, some of the destruction, certainly the threat to wildlife, just to the waterways, and some of the things that they had, I don't say stumbled upon, but encountered out there. And it was pretty eye-opening, at least from my perspective. And so, again, I for one, be interested in the information and how we might be supportive, again, because that role, irrespective of what we talk about here today, still falls to law enforcement, and certainly your team and the sheriff's department are one of the primary agencies in the unincorporated area anyway, where we largely agricultural, where these are, if they're indoor grows, you could have it going down the sewer system, but out there it's just spread on the land and it goes where it goes. So,
yeah. And I think I have a suggestion for you related to that later. But the waterways, frankly, significant concern.
Okay, very good. Well, thanks. I didn't mean to interrupt your presentation, but Supervisor Frost, you had a question?
Along that line, I wanted to ask, the environmental waste, is that something that, I know you're not an expert, but from what you've read, do you perceive it's something that has to be, can you clean it off of a property, or once you have someone buy a big property that has been growing marijuana and they've been using these chemicals, does it ruin the property forever?
I have no idea how long carbofuran would stay in the ground. That would be an EPA question for sure, but it seems like a very legitimate concern, and one that I wish I could answer. But
I've heard that the chemicals it's huge, and the water, they use a lot of water to grow it.
Well, I will be again, to be candid, I have concerns about when we do marijuana eradications of the illegal grows. Basically, my teams practically need to be put on a Tyvek suit and with masks on. That has not been a practice for many, many years. It has to be now because of what we are learning, what's in these plants is not great, especially in the illegal grows.
But, okay, then my other question is that your area of do you even enforce that, or is it more of an administrative, or who enforces this? Is it our code enforcement or the state, or?
That's again, my estimation is that it's going to be a combination. So the DA's office, I've met with Doug Whaley and talked to him about some of this. It can be code enforcement on some angles. It can be the state EPA on other angles. It can be the sheriff's office for some things. Ultimately, it could be the fire department. It's going to, frankly, require, at least if we're seriously considering this, a kind of a unique task force that deals with just this issue.
Okay, thank you.
This is a slide that I honestly had to question, but it's been backed up by more data. This is from the U.S. Department of Agriculture. I did not know this. I was flabbergasted by this, but when we talk about droughts, if one plant growing outdoors is 900 gallons in the growing season, and you start multiplying that over multiple plants that are legally grown outdoors, that is a significant water drain on our resources.
It's like almonds.
Huh?
It's like almonds.
Yeah.
This is from the Ecology Research Center. This is a kind of a partner with HIDA. They are looking at this from an ecological standpoint, and what I found fascinating was they are, again, backing up the 900 gallons per plant. They discuss fertilizer and pesticides, and they are studying that effect on outdoor grows, how they affect the environment with the various wildlife that's out there. Their suggestion, outside entity suggestion, is the ways to deal with this is essentially interdiction, enforcement, and disruption and removal of sites. That is their recommendation from top to bottom. And I mentioned I would talk about a model. This is San Diego's model. It doesn't have to be anybody's model. This is just an example of a model. It's one I actually think is fairly decent. Has a law enforcement component, has fire authorities, code enforcement, Department of Fish and Game, the Water Board, all working collaboratively to kind of address the outdoor grow issues that they deal with, the environmental concerns that they deal with. And I'm sure this was initiated in 2018. I would imagine it might have evolved a little bit. But this is frankly what would be required to do some sort of illegal, long-term sustainable plan, and probably ultimately, if we're in partnership with the business community in ways to make sure that the legal industry can keep growing. And I'll leave you with this. I know I've talked way too much probably at this point, and I apologize. But considering an illegal illicit enforcement program, the data is very mixed. To Mr. Cerna's point, it goes back and forth. One example of that is there's no vehicle code violation for driving under the influence of strictly cannabis. So I can't provide you data or numbers that say cannabis industry will create more DUI. I can't give that to you. I've talked to CHP about it. We can't do that. And then Sacramento County does have some pretty vast natural wildlife resources that are under threat because of legal grows and their correlation. So with that.
Great. Thank you, Lieutenant. We have some questions. I know that we'll get to the gentleman on the phone in a moment. So Supervisor Frost and Supervisor Desmond.
It's my understanding that trained individuals can detect if someone's under the influence, driving under the influence, and so that's something that you could do if we did legalize, or or is that something you're doing now, or?
You can certainly detect if somebody's under the influence of marijuana, but there is no specific penal code that says you are driving down the highway or freeway, and as a result of your actions, you were stopped and ultimately maybe arrested because you were driving specifically under the influence of marijuana. That's tracked under a different category, so it's very difficult for anybody to pull the actual strictly cannabis-related data as opposed to alcohol.
Or a threshold, right?
Or a threshold.
So there's no way to enforce driving under the influence?
Of strictly marijuana. Does that make sense?
Yeah.
You can certainly detect whether you're under the influence.
Well, that's a problem.
But to-
That
but to-
seems like a little bit of a problem, doesn't it?
I think I was talking with CHP this week, they tend to view that as a problem.
Thank you.
Good segue to Mr. Desmond.
That's perfect. I'd
I
like to
figured it
weigh
was
in on
coming.
that issue at that point. I worked. Actually, there was a lot of discussion about this issue when Prop 64 was going through, and the authors, with some CHP involvement, they inserted some language and some funding in that proposition to provide more training for law enforcement throughout the state. But yeah, there is no blood alcohol, like there is an equivalent section for a specific blood alcohol level. You know, if you're 0.08 or above, there's no objective level because cannabis is a completely different, you know, substance. I mean, and impairment will depend on, you know, frequency of use and things like that. But I mean, they are doing a lot more in terms of gathering the data, and if they do detect someone driving under the influence of some other kind of controlled substance, and there is a test, they're doing a better job, I think, of keeping the records. I mean, it hasn't become a huge crisis like a lot of people feared, and that is certainly the case. I mean, that's been the Highway Patrol's experience. Yes, more difficult to test for it, but we're not seeing huge problems on the roadways. So thank you for the presentation. I think this is it's very valuable in terms of a policy discussion at one point. If this board does choose to put an ordinance or a ballot measure on the ballot in terms of taxation, and then we would have to decide, if that passes, decide on what we would do from a policy perspective. And I think this is really valuable. For me, it seems like a lot of these issues are also, you know, we're kind of relitigating or arguing about something that has already been decided. Cannabis is legal in the state of California, and that is not going to change. Right. And we are surrounded by it. And what I would ask you, Lieutenant, what you're on HIDA, you're obviously very aware of, I guess, the proliferation of cannabis in Sacramento County. And let me ask you this. I mean, is there cannabis in unincorporated Sacramento County?
I'm sure there is, yes.
Okay, well, thank you. I know for a fact there is, because I know an awful lot of people who use it recreationally, and they go buy it in the city, or they get it delivered to their address in the county. And so many of the things you're talking about here are clearly why the public voted for Prop 64, because people said, look, it's here, it's a reality. These environmental crimes from outdoor grows, these candy that's marketed to children, we need to take that industry and regulate it and protect people who are vulnerable to it, or vulnerable to its abuses, whether it's environmental crimes or in the retail world. And I think that's where, you know, I'm very interested in what your comments were and how you kind of square your own experience. And you mentioned Santa Ana with some of the studies that you cited, because those studies seemed pretty unequivocal that even where it became legal, we were still seeing the same amount of problems. But you're saying you're not, you know, you quoted the Sacramento Bee study. What's your own experience in the county?
Okay, I want to make sure I'm understanding your question correctly. My experience in cannabis and crime, are they correlated, and has one increased or the other?
Yes.
I would suggest to you that cannabis and crime can be related, but again, we're talking different levels. We're talking homicides and robberies and things like that. Whether there's been a mass explosion in one or the other, I'll be very candid, we have not tracked. So what I mean by that is, when we go to a call for service and somebody has been, I don't know, beaten, stabbed, or something like that, there is no field for us to say, was this a cannabis-related event? Did this occur because it was a marijuana robbery? So that data, to track that data and tell you very specifically that we've had 12 homicides directly correlated to marijuana, I can't give that to you. I do see that as an experience, having 22 years now going to calls for service, reading about other calls for, and at my level at the HIDA now, seeing other agencies and what they're up to and what they're dealing with. We certainly see violent crime as a correlation, but I think those things may just be part of, if for lack of a better term, that's just part of that culture. Does that make sense? The illegal,
and I think that's the
right. I'm not suggesting this is the legal
market
dispensary is a violent criminal network. I'm not suggesting that by any means. I'm just suggesting that when we deal with the illegal market, you have a lot of
it's a
criminal network,
occur.
Right? We have cartels involved in this growing behavior. We have gangs involved. We have a lot of different criminal elements doing this because there's a lot of money in it.
Right. And you also see some of the illegal actions marketing to children. You see the environmental crimes, and to me, I mentioned this when we talked about this a few weeks ago, that this discussion all screams to me for more state involvement, state consistency throughout the state. That would be helpful to law enforcement. I know that too, but I think the biggest problems are clearly caused by an illicit market, and you're right, having a tax structure that's fair and reasonable and balanced, that strikes that right balance in driving away the illicit market and helping legitimate businesses succeed is what we should be looking at. But thank you very much.
Supervisor Cerna.
Thank you, Mr. Chair. First, let me say I appreciate Supervisor Desmond's questions and comments, and certainly feel likewise about his unique lens that he gets to apply here based on his his past profession of enforcing the law. I think it's going to be very helpful to a robust discussion at a later time in terms of the policy implications. We certainly want to thank the Lieutenant for his very thoughtful presentation, but I also want to just underscore at least kind of generally what I took from it, which is there is a substantial amount of very useful information here, but much of it seems to be centered around the illegal, illicit impacts associated with cannabis, which is helpful. But you could probably have guessed from some of my leading questions earlier about kind of the statistical demonstration of connection between cannabis and certain other cultural factors or criminal activity issues. That's kind of where I'm hoping to acquire even more understanding about the specific impacts associated with legal, regulated, taxed cannabis, because that's really what we're talking about. We're not, at least I'm not talking about any way sanctioning or doing anything even unintentional that would influence even more illicit activity. That I don't think that serves any of us well. And in fact, we're probably more interested in going in the other direction to figure out how we take even greater steps to tackle that problem. But I think overall, this is again helpful. It raises some other questions for me that I think in the course of that later policy conversation will come to bear. So. Again, just wanted to thank you for giving this so much thought and sharing it with us.
If I may, to your point, there's more studies being done by the state of California directly related to legal cannabis businesses and crime. They're still being done. I get no way to pull the data, but it is being done.
Sure, no, I appreciate that. I mean, it's such a great diversion from decades past in terms of the illegality of it, that it's still relatively new. So in fact, there's probably lots that can be said about the legal market that we won't know for decades, because it's just going to take time and experience to understand what those impacts are. But couldn't agree more. Thank you.
Yeah, sure.
Just add one more last point. I mean, I think if this does move forward and we get to that point where we're having that policy discussion, I mean, your voice will be critical to those efforts to help inform ultimately the decisions we make. So hopefully we'll be seeing you again.
I'm happy to assist. All you got to do is call. You know that.
Great.
Thank you.
Thanks, Lieutenant. Before you leave, I just would say I think that the example of the San Diego Task Force, irrespective of what happens on other matters that are related to this, I think that with the large agricultural landscape that we have in this county, that it would be, I think, useful and probably helpful, not just to law enforcement, but I think, and I guess I would just direct my comments to the county executive, to look at how, again, we might constitute something that would certainly allow for response where appropriate. And we took the code enforcement approach here relative to illegal grows and, $1,000 a plant, blah, blah, blah. The folks know how to play that game too. We go out there to confiscate and, they move them the night before we get there because we give them notice. And then the aftermath, or the sheriff gets a complaint and goes out with code enforcement, and they get wind of it, and they leave a mess. But clearly the plants are gone, and I don't know that administratively we've collected one penny from, again, kind of a paper tiger ordinance that we put in place. But I do think that having a task force that involves, certainly our public health, our environmental management, probably our ag commissioner, and law enforcement, and maybe some of the folks that were mentioned here that aren't necessarily county associated, certainly fire departments as well, because there's an issue out there, irrespective of what's done about the matter we're talking about related to a tax measure and or allowing for activities that are permitted under the state if the local jurisdiction so desires to do that and undertakes that. And so I think it would be helpful because I think the exposure out there and with the waterways, and again, maybe that information we're talking about you've learned about recently shared with us as it relates to new chemicals or chemicals that are very potent that are being used, but are actually, if they're being identified as you folks are going out this season and the seasons to come, we need to be concerned about that. Those are, again, those waterways we fight, to protect our delta, to protect our waterways. We talked yesterday just, regarding trash and debris and other introduction of all kinds of materials into, basically not just our drinking water, but into water that's so important for so many reasons. And if this is an issue, I don't know what magnitude, so I don't want to, as I said earlier, overstate it. But if we're finding that, then we ought to at least be prepared to, at the local level, do what we can to, be responsive in, collecting that material, seeing to that it doesn't get left just on site, and maybe there needs to be some ability to confiscate and to then dispose of. And if there's a cost associated with that, we ought to talk about that. So maybe something internally, and that we could have some discussion about and report back to the board at the appropriate time. So
We can certainly take a look at that.
okay, thanks. I wanted to say before you leave, I think Supervisor Frost had asked a question earlier, and you mentioned that David was on the
line. Yes, that's what I was going to just suggest.
Okay, sorry. Okay, yeah. So again, assuming you heard the question, if not, you want to restate the question so he can respond to it. I trust he's been listening in, though. David?
Chairman Natala, I'd actually appreciate the question. I heard it in different views, so it might be helpful to be clear I get the answer.
Okay, Supervisor Frost.
Go ahead. I think it was relating to, oh gosh, what was my question?
Who enforces it? Well, yeah.
Who enforces?
Taxes, who did the taxing?
No. Okay. Thank you, Natasha.
Sure. Supervisor, you asked what the state taxing rates were. You were wondering what.
Oh, yeah. I wanted to know because my understanding was we make the small amount of the tax, but we bear the burden of administering everything around it. And the state really gets most of the money, is my understanding. Is that true?
So you are correct in part of that, in that the state charges an excise tax, which we went over in our presentation. They charge a flower tax to the cultivators, which they are looking at eliminating, and they have an excise tax of 15% that they are removing. Can you hear me okay?
Yes. Yeah, I'm not sure I understood it, though. I'm sorry. Can
So
you?
let me clarify it. So Prop 64 had indicated that there would be a excise tax.
Hello?
Am I talking over you?
You're kind of breaking up a little bit, David. I don't know. We got part of that.
So to clarify, can you hear me okay?
Now,
We missed everything except, can you hear me?
Okay. So back to the state. So the state has a tax on per ounce to the cultivators, which goes directly to the state. Then they have a 15% excise tax from the retailers that goes to the state. And the way it's designed is Prop 64 then breaks down the funds to go to public health organizations, youth prevention organizations, law enforcement. I think one of the board members indicated about the Highway Patrol. They get funding for studies related to DUI arrests and things of that nature. So it goes into big bucket funds related to that. Now, when it comes to the local side, to the county, that is the purposes of developing a tax ordinance so that whatever funds come from that go directly to the county to do what they want for general purposes.
Is that a set percentage or what's left? I mean, what is left after all that? Do you know?
Yeah, so when we went through that presentation, depending on the types of activities that you may consider permitting, if you even do, then the tax rates are different, as we did in the discussion about the various activities that may occur that you permit. If you don't permit certain activities, obviously then you don't get any funding from that. But those that you do fund, the highest rates typically are on the retail because that's the one that makes the most profitability in the industry.
Is there a way for us to charge less, like if we wanted to make it more, like if we wanted to place requirements for organic growing and that might cost more to grow, but we would tax less? Do we have flexibility or is it set in how we have to tax?
You have flexibility to create subcategories, subsections, sub-activities, for example, indoor grow, mixed light grow, outdoor grow, or even the types of activities which would be volatile extractions products versus non-volatile extraction products. They typically have different price point rates in which you can have some flexibility that makes it difficult when you have deliveries coming from out of town, where people will then just buy from places that you can't regulate as you are today versus buying something that would be in the county.
Thank you very much.
Thanks, David. Appreciate it. Good. Lieutenant, thank you so much for your presentation. Thanks for being with us this afternoon. Appreciated your response and your presentation. Okay, we do have a caller on the line. Okay, so we'll take the caller. We have another portion of this.
We still have a presentation, though.
Yeah, we still have additional presentation. We've got Dr. Melody Law and Dr. Ryan Quist from DHS who will be coming up.
Okay. Good afternoon, Melody. Good afternoon, Ryan.
Good afternoon, Mr. Chair and supervisors.
Is this your first time presenting to the board?
Oh, yes.
Oh, very good. Well,
I'm Melody Law. I'm a Deputy Health Officer with Public Health.
Great.
Behavioral Health and Public Health have prepared this brief presentation on health impacts of cannabis per board's request. Smoke cannabis.
Dr. Quist knows how to run the clicker, so you're in good hands. He was here yesterday. Go ahead, Melly.
It's okay. Smoke cannabis, regardless of how it is smoked, whether it be through vape devices or any type of smoking devices, aerosol devices, can harm lung tissues and cause scarring and damage to small blood vessels. And also, cannabis smoke has many of the same toxins that tobacco smoke does, all the carcinogens and irritants. Another thing is that smoking cannabis can also lead to, this is an acute health issue, smoking cannabis can lead to a greater risk of bronchitis, cough, mucus production, although with cessation of any of these behaviors can generally improve. And just like tobacco smoke, cannabis, secondhand cannabis smoke can also contain many of the same toxins and carcinogens. Moving on to some health impacts on youth, the human brain develops until about age 25. So use of cannabis during the adolescent age and young adulthood may harm the developing brain. The negative effects of this include difficulty thinking and problem solving, and problems with memory and learning, reduced in motor coordination, difficulty maintaining attention, and problems with school and social life.
Okay, if you can pause just for a moment, Supervisor Frost.
Sure.
I'm sorry, I must have.
That was last time? Okay, all right, very good. Continue, Melody, thanks.
Go ahead.
Good afternoon. Ryan Quist, Behavioral Health. The couple, just a few brief points that my prevention community would likely include as a part of the impacts are first, higher potency marijuana has been found to be more addictive. We see an example here where it says one study showed that potency today versus 20 years ago is akin to caffeine change from 120-ounce cola a day to 33 16-ounce cappuccinos a day. In addition, we have seen that cannabis may lead to increased emergency department visits. That's something that we are hearing from our EDs here in Sacramento County.
Okay, pause for a second. Supervisor Cerna.
Thank you. A little puzzled by this slide just because the first bullet point speaks to addiction, and it makes a fairly broad statement about potency being connected or influencing level of addiction. And then the quote is puzzling because it doesn't really doesn't offer anything in that context. It makes a connection to caffeine, I guess, which I guess that's I guess it's an addictive substance. I don't know, but it's not really. It seems disjointed. So I'm just wondering, because I've always heard, and again, I have not delved into researching in any great detail the addictive properties or not of marijuana, but I've heard over the years anecdotally that it's not necessarily an addictive substance. So can you help reconcile that for me?
I've heard that narrative as well. Within our prevention community, though,
is your mic on?
I'm sorry?
Is your mic on?
No, do you want to use it?
Sorry about that.
No
All
worries.
right. Within, I'd say I've heard those conversations as well. I'd say within our prevention community, we have youth that have come forward and talked about their experiences with addiction, where they perceive it as an addictive experience, and so I have seen both sides of it. The example here was intended to equate the addictiveness of the caffeine. That if you drink a lot of caffeine, you are more likely to get addicted to it. And likewise, if you smoke more potent marijuana, the thought is that you're more likely to get addicted to it.
Is it the thought or the proof?
This researcher, you'll see researchers with various points. This researcher concludes that it was addictive.
And not to go too far down this path, but can you say with any authority today, has cannabis been determined to be chemically addictive? For instance, compared to opioids?
Chemically addictive.
Well, you know that opioids, they block the mu receptor, and there's a lot of science behind, neurological science behind why it is physiologically addictive based on its chemistry, its effect on the brain. Is there something similar for cannabis?
I think we've hit the end of my expertise on that. I'd say what we have is we have youth coming to us telling us that they have an experience that feels addictive.
Okay, thank you.
I would just say, though, to the comparison there about potency, I don't know if it'd be physically possible to drink 33 16-ounce cappuccinos in a day, but if somebody did that, they'd be... Man, no wonder I could drive 120 miles an hour. Holy smokes.
I certainly don't challenge the claim that today's cannabis, generally speaking, is much more potent than it was in the 60s, 70s, even the 80s. I mean, I've heard that consistently from different, corners of the community, but I just there's that part of it, potency, and that's what I was getting at. Is potency and addiction seem to be two different things, at least for me.
Appreciate that. I wanted to ask both about the second bullet point there, the one on the emergency department, emergency room visits, and this takes a period of time, 10 years, 2005 to 2015. But what really struck me was that you said that we're seeing a parallel rise as you're hearing from some of the health systems. Could you elaborate on that? Again, if we're, we're going to hear, I guess, in a couple of weeks about the health prospects of medical marijuana or marijuana in general. But this statistic, for one, even though it may not be legal, there's access through a variety of means for young people. And if they're showing up in the emergency room, I guess I'm curious about that. Ryan, any more information you have, kind of the local take on that?
I think this next slide sort of talks to where some of that might be associated. Cannabis disorder has also been associated with depression, suicide, and psychotic symptoms. And so that's something that we are seeing in some of the emergency rooms, is where they're experiencing other symptoms that came along with that. I will, the other thing we've seen also in research is that we have a conversion, what we call a conversion rate from temporary psychotic symptoms to chronic psychotic symptoms at a higher rate than some other illicit drugs.
Twice the level of opioids?
That's what the research.
Is there a way? Could you you listed this on the web, but could you? Is there a copy of that study available? Could you send a hard copy of that? Everybrainmatter.org. Is that just
Sure, happy to follow up.
Yeah, if you could. Yeah, I'd be interested to see that.
Sure.
Yes, sure, sir.
Hopefully you can hear me. So I just want to make sure that when you say chronic psychotic symptoms, is that the same as permanent psychotic symptoms?
Chronic means long, sustained over. Right. I don't know about permanent. That would be a difficult one for me to.
Okay. I as a non-scientist in this field, I would speculate that amphetamines, especially methamphetamines, have a much more permanent psychotic effect or influence versus cannabis. But I would love to be proven wrong with, the science.
Sure.
Yeah. I guess I'm curious too, because we talk about conversion rates, but I don't know what they're, again, not a scientist, but I would be interested in the data because, how big of a group, what sort of grouping you're looking at. You're looking at hundreds versus thousands versus tens of thousands. I mean, I don't know. But that's I guess I find out it's a little bit startling, I guess, if I no better way to say it than that. So almost 50%. So
to that point,
yes, Vice Foss, go ahead.
Through the chair, I do have a friend who had a son, age 18 or 19, who smoked marijuana and flipped into a psychosis and schizophrenia. And I have read studies in the past around this that I guess between the ages of 19 and 25, you are those people who are predisposed to schizophrenia. Oftentimes, that's when it manifests itself, and I don't know if it's is it THC? I don't know why it's stronger now than it was in the 60s, but that's what I've heard also. But they're saying there is a percentage that are. That seems, is that what you understand? That they're actually, is it the THC that's causing them to flip into schizophrenia?
That's what the research, is this one working any better?
Yeah.
Not much,
Not
but.
really. That is what a number of researchers are suggesting.
Okay, thank you.
Maybe we can get a handheld mic that has a. So, I know we didn't know what I was going to say. See if we can get one that has a. If the battery's dead on or something, we can check. The clerk's office can check that for you. Thanks. Go ahead. I don't because it makes it tough. You got to keep flipping back and forth. So, go ahead.
Yeah, we just have a few more slides. I just wanted to answer Supervisor Cerna's question about addictive properties of marijuana. On my non-public health hat, I'm an addictionologist, so I practice in substance use, and yes, it is known, and CDC also notes that to be an addictive substance. And potential of addiction comes on the amount of use over a span of time. So it depends on both potency, chronicity, and the amount that is used, and also when a person is used at a younger age, the addiction potential is higher.
Thank you. It's good to know I'm speaking to the right person. So is there a difference though between physical addiction and psychological addiction?
In concept of addiction, it's actually a combination. If a person is addictive to a substance, it's both physiological and behavior. So in any type of substances, including cannabis, opiates, it is when you're treating, you have to treat both. So yes, so both components are involved.
So someone that's trying to withdraw from years of high-potency cannabis use will have physical symptoms manifest?
Correct.
Okay.
So there's acute withdrawal symptoms as well as we call post-acute withdrawals. Mm-hmm. So that's after, 10 to 12 days, 20 days, and then there's a long-term acute, long-term withdrawal symptoms that can come and go. So it depends on chronicity of use. So if you're a short-term user, then the withdrawal symptoms may disappear, but if you're a long-term user, that may last longer.
And I let me just state the obvious. I assume that all applies to alcohol.
Yes. And the other question was asked about the opioids and the psychological effects of it. It is true what Supervisor Frost said. The potential of having psychosis, developing the THC or stimulant aspect of it can serve as a trigger, a stimulant or a trigger. So moving on to cannabis in pregnancy, we see that cannabis smokers who are mothers can have problems in their children when they're growing up in attention, memory, behavior solving skills, and in their children. And also the newborns, acute effect would be in newborns, they can have lower birth rate, lower birth weight and size, and including abnormal neurological developments. So the THC that was mentioned, the tetrahydrocannabinol, the psychoactive compound of the cannabis can pass to infants through secondhand smoke.
So can I ask you a question, Melody? This all relates to, at least as you've been outlined, largely to smoking, that ingesting it that way. What about if you with the edibles that you ingest it that way, is that then still transferable to, in this case, the fetus, to the baby, or can you have similar effects that we talked about, long-term effects, addictiveness, and so forth? Does that apply?
Are you talking about edibles?
Yeah, edibles. Yeah.
Well, secondhand smoke is just on the smoke.
No, I wasn't. Yeah, I know. I heard that smoke. But I'm asking about can the infant or the newborn going to be transmitted through, or is it only through smoke?
I have actually not read anything with regards to edibles, so I'd rather not say anything that may not be correct.
All right. And what about? But let me ask you about edibles that relates to the person that's ingesting them, though. The questions that you were responding to Supervisor Cerna a moment ago about the addictiveness and chronicity of after effects depending upon use and so forth. Does that apply to edibles, or you haven't read anything about that either?
So the edibles, though, the different effects of it is the potency of it, because a person, depending on manufacturers, even though a particular piece of edible will say whatever the concentration is, but it's not widely spread. You would think that one piece of 5 milligram, let's say, you think it's evenly spread out, but it's not. So if a person eats a particular piece that is highly concentrated, then you can have an acute effect. But the chances of spreading it, passing it on to a child, fetus may not be.
Okay, I get that part. But what about if somebody continues to use edibles over the long term, in depending on quantities and potency and so forth? I guess I'm just asking about
Right, yes. So, yes, depending on use and chronicity, there is also negative health effects. Yeah.
And just one other thing, you saw the presentation that the lieutenant, and it was reported in the news, the knockoff on the on one of the candies that has colorful
Brandy.
Yeah, branding, right? That's good way to state it. So those types of things, you could actually have an acute effect depending upon how much was loaded into that.
Absolutely.
Yeah.
Yeah. In those products, usually, it's not really marketed with a certain amount of milligrams posted, right? So
right, it's not. Yeah. So a knockoff on Skittles in this case, it could be very harmful, or it could be more or less addictive depending upon what was in it. But you really don't know because it's not listed on the packaging.
Correct.
Okay.
Yeah.
All right. Thanks.
So with legalization and commercialization, so some states have, Colorado and others have legalized cannabis. And as Ryan mentioned, studies have shown increase in ER visits, DUI, and the poisoning. The poisoning is specifically related to the varying concentrations in varying products. And also the self-reported cannabis use has increased in some groups. And I will say in next slides that could be due to perceived social acceptance of it. So maybe they're reporting it higher. Other limitations is that lack of historical data on this issue. It creates challenges in making conclusive cause and effect. And now that more states are legalizing it, maybe more impartial research may show the positive impacts that Supervisor Cerna was talking about. Lastly, it is difficult to measure impacts of commercialization in areas where legalization occurred previously.
Okay, Supervisor Frost had a question.
Would you say that cannabis or marijuana is a gateway to opioids or other drugs?
So CDC research does show that youth that have used marijuana, cannabis, have higher rates of using other substances, including alcohol, opiates, stimulants.
Thanks.
Could I dovetail? Same for alcohol, similar to alcohol?
Starting cannabis as a primary?
No, can it be stated that accurately that alcohol can also serve as a gateway?
I guess anything can be. I have not read up on that specific aspect.
Okay.
Yeah.
Good. Any other questions of Melody or Dr. Quist? Well, we appreciate you being here, and to know that you're an addictionologist. We may call upon you at some future date to weigh in, but certainly thank you for your work with public health and for compiling this information today. Anything else you want to conclude with? Or okay, thank you. All right, does that conclude the presentation? It does. Okay, then we do have a caller, and I'll bring it back to the board before we close out.
You want the caller? Okay, please
Yep.
transfer the caller. Hi, caller. Please start with your comments. You have 3 minutes.
No worries. All right. How you doing today? Good afternoon, Board. This is Mackenzie Wilson. I want to preface this statement with the fact that I actually love this plant. And I love that it is growing on corners in other countries just like a shrub. Of course, the concern goes down over age. The fear tactic of just saying no, drugs are bad, scares children. And as they grow up and they realize they've been lied to about it, of course, the concern changes and the concern goes down. The first presentation with 10-year-old data was one-sided and full of bias and full of misinformation. And I recognize it was his job to do that and make sure that we fear crime to justify their budgets. But what a stretch to correlate domestic violence with pot smoking. And shameful that we screenshot this document without reading it fully and having anything accredited or really to back it up. Not excusing the child that brought a bag of Skittles of what they thought was candy to school, but, excuse my language, but still, shit happens. And things are accidents. My kids even asked me about my cookies, and my dog's eating my pot. And the reality that cannabis is saving children's lives is way more real. Of course, the black market can't keep up with the taxes and regulations. Had it not been treated like a new gold rush and charged so much for permits and things, growers wouldn't have to find markets that will bypass all of the regulations. This black market is fueled by people who cannot afford the high-priced weed. You have no idea how many medical marijuana patients we've pushed to the black market just so they can afford their medications, and how many small businesses are struggling to survive who are there now as well. I appreciate the addition of the recent and local data that refutes half of what that first presentation highlighted and talked about for most of it. I appreciate him admitting that he didn't have much to go on, and I still hear that they were unfortunately trying to make connections that were way out of their purview. My point is that this presentation is nothing but fear-mongering, and as the data showed in the beginning, as people find out they've been lied to about it, the fear dissipates. I guess my concern is that all of this enforcement is going to go into the little guys in our community, the ones already struggling, the ones being forced into the black market, the ones who want to learn about how to grow it safely, but live in a county that comes from a carceral lens instead of a public health one that would provide resources on how to use marijuana and grow it safely and dispose of some of that safely without punishment. I'm fueled by loss of billions. I'm not into your legal roundup. Whatever model you create should include and I heard you say this, Natoli, so thank you so much, but should include things like the Department of Public Health and come from a place that values lives over money and incorporates the war on drugs and the very real disenfranchisement analysis that this will and has always brought to communities of color. And since we're asking about the taxes, it'd be cool if somebody could ask and have presented how much of that money goes to community and how much of that goes to cops. Because if the cops are going to ask for more money to do enforcement on this, I'd like to know by line item how they're already spending it. I also want to know how come the DHA presentation didn't mention that cannabis helps with asthma, depression, PTSD, schizophrenia. I can speak to that personally. I'd like a better understanding of the word may have effects. Are these guesses? And I keep hearing from the prevention community. I think this speaks to my just say no and drugs are bad and is not a realistic approach to anything, let alone drugs. Please move away from just say no and teach my child and our children how to use these things safely. And to be cognizant of the increase in psychosis. It is very real. It is happening. And of course, we need more studies. But it's your regulated market that's actually fueling higher THC rates, not illegal ones. Your market created and fostered it. So the fact that this is happening, and again, we need more studies, the regulation goes back to your competitive legal market and speaks to even more of a reason to teach my kid and this community how to use these things safely instead of just say no. Just say no is why we're sitting here saying that we don't have enough data, don't have enough studies, and have no real understanding, and have people who are on my tax dollars payroll coming up and talking from a one-sided, not open-minded approach to how do we handle these kinds of crises in our community. Thank you very much for your time. Have a great day.
Great. Thank you, Mackenzie. Appreciate your comments. Okay.
Okay, and I believe we have one more caller.
All right.
Hi, caller. Please start with your comments. You have 3 minutes.
Hi, Board of Supervisors. I honestly couldn't say it better than the previous caller in just critiquing and the presentation from before, but really thought it was adorable at certain points. It's about as adorable as the old school DARE program that I went to school with, and had to look and ended up finding, after several conclusive studies, found that it provided no decrease, no meaningful, substantial, or even statistically significant decrease in drug use. It may have actually encouraged people to use drugs. So kudos to reminding us of that old war on drugs relic. But I have a couple of serious questions. Now that we've had a report back on the health and safety considerations relating to cannabis, first, are we going to have a report on the positive uses on health and safety for cannabis? And two, are we going to have any report back on the health and safety considerations relating to alcohol as well as tobacco? Preferably separate presentations, given the fact that alcohol kills no less than 10,000 people on a yearly basis. Cigarettes are attributable to over, almost 500,000 deaths just in this country alone, and then 0 deaths related to or directly connected to cannabis, mind you, which I appreciate that nobody in this that presented today tried to make that claim. But just wanted to, I really do want to know, are there going to be any report backs on the health and safety considerations relating to alcohol or tobacco?
Okay.
Thanks.
Yeah. Thanks, Keon. I know we are going to have a report back on July 12th as it relates to cannabis, and Supervisor Cerna had asked about that very early in the presentation, so we will have on the health impacts and the, I guess, positive health impacts perspective. So that'll be on July 12th. And we'll also have on that day for board's consideration, at least as it currently stands, the measure that we talked about previously. So that'll be as a part of the agenda as well. Is that accurate? Okay. And certainly understand your request on alcohol and tobacco, but as it relates to cannabis, we will have that presentation that you referenced on July 12th, coupled with this other item relates to a measure that may go before the voters. All right. Any other callers?
No, that was it. I'm just triple checking the queue because sometimes folks slip in, and I closed it when he was finished talking.
Very good. Okay, thank you to Mackenzie and to Keon for your comments. And with that, thanks to our presenters. Board members, any other comments for today's purposes? We will return back with this item, now having had presentations on different aspects on 2 different occasions. So July 12th, and we should allow sufficient time for that in our agenda planning. So.
I also want to add that that July 12th presentation on the medical benefits of cannabis is contingent upon us locating someone who is available on that day. We will make every effort to make that happen.
Mr. Chair?
Yes, sir.
If our executive team is having any difficulties, please reach out to my office. We can assist.
Great, thank you.
Okay, very good. Okay, and with that, just in light of them, I guess you will have a draft. Turn to council for a moment, because there certainly has been indication by a number of board members that they're interested in pursuing this. It does require a 4/5 vote if it's to go to the ballot. Will you have them before board's consideration, I guess, a draft measure? Because it's going to have to be ready to go, right?
Yes, the staff has the ordinance, and we will have, I believe, the draft measure ready for the 12th.
Okay, all right, because it would be introduced on the 12th. It would have to come back on the 26th, no?
No, it's not that kind of ordinance.
Oh, it's not?
It's basically the measure is what needs to be put on the ballot, but you don't have to introduce it and continue it and pass it, because you're not passing the ordinance. It would be the voters that actually pass the ordinance.
But you actually have until the 26th, do you not, though, technically?
Yes.
So
we have till past the 26th. I don't know the exact. I think it's August 4th, but yeah.
And I was saying the 12th because I was under the same understanding as you that we had to introduce it and wait. So.
Okay, so it may come back, depending upon, again, we're going to be meeting the 12th and the 13th, and again on the 24th and 25th?
26th,
26th, 27th. So it will be at one of those dates, and again, we'll shoot for the earlier July meetings, but again, depending upon availability for folks and what has to go in for board's consideration, it needs to be fully developed if we're going to take it up. So, okay. Yeah, because I was under the same impression as you, and that it had required that introduction in 2 weeks before you could actually go forward with that. So, okay. Any other questions on procedure-wise? So we will see this back in July. Again, thank you to our presenters, and that concludes the hearing on this. We'll see you back. Next item, please.
Okay, item 5 is the adoption of the 2022 Sacramento County Extreme Heat Hazard Annex and Extreme Cold and Freeze Hazard Annex.
Okay. Mary Jo, good afternoon.
Let me adjust the height here.
Yeah.
Good afternoon, Chair Natoli and members of the board. Excuse me, Mary Jo Flynn Nevins, and I'm your Chief of Emergency Services. I'm here to present to you an updated plan for the county, actually 2 plans for the county's response to extreme weather. These plans are consistent with the recently released extreme temperature plan from the California Governor's Office of Emergency Services and are consistent with federal planning guidance. We have worked closely with the National Weather Service office in Sacramento. In fact, I have Courtney Carpenter here from the National Weather Service office, should you have any questions for her. We've worked with them over the last several years to test their new weather products related to heat and cold. We have incorporated these new models and data into our planning documents. These new models align with your board's priorities for climate adaptation and sustainability, in that these models bring consideration of local climatology and CDC health data risk. We also have worked with our cities, local partners, and involved departments such as public health, human assistance, child, family, and adult services, and agriculture to provide comment on the plans. We've also presented the plans to the Operational Area Council and solicited feedback and comment. All comments received on the plans to date have been incorporated into the final plans presented to you today. Our goals with these plans were to simplify and expedite decision-making so that communication with the public regarding threats from extreme weather and the actions necessary to maintain health are clearer and more easily understood. The plan has been simplified from 4 phases of activation to 3, and this is consistent with the state's plans. Basically, we have a readiness phase of activation where our office will convene our stakeholders and provide public education. A watch phase where we're getting notification from the local weather service office that we should anticipate extreme weather of some sort. And we will start coordination calls with all of our stakeholders and ready logistics for distribution as needed. And then the warning phase of both of these plans, which will be our actions to implement the plan. Before you is a sample of the National Weather Service's experimental heat risk. This is a product that we have been working with them for several years to test within our office. Our previous plan relied on the heat index, which only ranks high temperatures and humidities, and caused us to have that 105-degree daytime temperature, 75-degree load temperature. By moving away from the heat index and moving to the experimental heat risk model, it offers an alternative holistic solution that uses high and low temperature forecasts, but it adds data from the CDC heat health thresholds, local climatology. It takes into consideration the duration of heat and the heat island effect in urban areas. This is something the previous heat index did not do. The National Weather Service experimental heat risk product graphically displays where the most severe heat will be within the county. So we can see at a glance, in these examples here, the northern portion of the county had more extreme heat that past summer. And response efforts are only one component of an overarching emergency management focus to extreme weather. Pre-disaster mitigation activities identified in the county's local hazard mitigation plan are necessary to reduce or eliminate the exposure and threat of heat-related issues.
Major, before you leave that slide, could I just take you back there for just a second? Just looking at the middle, the Sunday outline there with the magenta and the red, I'm curious about that band that runs down through the eastern portion of the county where you've got, in fact, I have a different graphic, I think, than the one you, no, I guess it's similar, where you've got an area that's high heat surrounded either side by, I guess, a less severe category, or vice versa. So what is it there? Is, you don't have an urban setting, you got a rural setting, you got some more maybe irrigated parcels of land. I'm just curious, though, you get that, you see what I'm talking about there?
I'll rely on Ms. Carpenter's expert advice on this, but I believe it has to do with the influence of the Delta and the Delta breeze that usually has an impact on cooling the southern portion of the county.
But you got that band. I'm talking about, you see that?
Oh, on the
Sunday chart there,
eastern
yeah.
side?
Yes,
yeah.
on the eastern side. Yeah, I get the Delta, but you're pretty far away from the Delta there, so.
Mr. Chair?
Yes.
Could I just make an observation?
Yeah.
It's really not a band per se for Sacramento County. It's just that we're seeing a portion of the larger area. So if you were to expand out, it's a leading edge of it, but it's not a band that's specific to the county. Do you understand? Because the magenta extends to outside to looks like Sutter, El Dorado, Amador, San Joaquin, and other points east and north. Does that make sense?
Yeah, it does. I guess you get the, rather than being, contiguous, you've got this break in between the two colors, or that's what, leading edge, or so what's happening there meteorologically or otherwise that you would make a declaration for certain areas?
I'll let Courtney Carpenter from the National Weather Service Sacramento office answer that.
Okay. Hi, Courtney.
Hi.
Welcome.
So the magenta heat risk takes into account the duration of the heat. So when you get the red level, which is kind of your highest level of calculation for 36 hours or more, it goes to the magenta. So when you get to the magenta, we're talking your long duration events. Typically on the east side of the county into the foothills, there's kind of a thermal belt, what we call, and the heat is trapped kind of in the hills and it doesn't cool down at night. So typically when you get those purples, we're seeing very high heat during the day and then not much cooling at night. So if you were to zoom out, you'd see kind of a purple area that delineates kind of the foothills where we're not cooling at night for this particular event.
Of course, you haven't hit the foothills quite there. I mean, you're just at the toe of the foothills.
Right,
yeah.
but this is just kind of a one event. It will differ from event to event as the temperatures differ, and as Mary Jo mentioned, sometimes we get that
wind
delta
patterns,
breeze.
yeah, and that's very
So
cool.
the magenta level is indicating really your long duration, more than one day. It's 36 hours or more of.
So if you're looking at real estate, it's a little cooler in that one section of Herald than it is in the other cooler.
Yeah, if you want to be cooler, live closer to the delta.
Oh yeah, I get that. So, okay, great. Okay, thank you.
Thank you, Courtney.
Thank you, Phil. Okay, go ahead, Mary Jo.
The heat risk criteria is before you. It displays the 2012 criteria that we were relying on and what is now included in our 2022 plan. Basically, we are going to be relying on utilizing the National Weather Service's issuance of an extreme heat warning. And we will also take into consideration using that experimental heat risk model and whether or not it's at that magenta level for 3 or more days. Additionally, we have criteria that balances those issuances of warnings, where if they issue a partner email, advisory, watch, or a warning in addition to other factors that contribute to heat health risks within the community, such as abnormal human medical emergencies and mortality, abnormal animal mortality, or an electrical supply issue that impacts electrical supply and distribution within the county, or is completely disrupted due to temperatures, we will take action. And typically the actions that we take start with cooling center activities, but they also include activities from DCFAS, who provides outreach to seniors and provides education about how they can care for themselves in their home, and resources that they might need to continue cooling. It includes pre-warning activities. So warning is a product issued by the National Weather Service. And before we get to that point, DHA has in the past opened their lobbies to make making motel vouchers available. And these are just important tools in a comprehensive response. We coordinate with the Department of Agriculture, and it's important in ensuring the health of animals and livestock and ensuring that the community's agricultural products are monitored. And then finally, we have public education from public health, which is critical to ensuring that all residents have access to timely information so that they can make individual decisions about their health and their needs.
So could I just ask you then, on the 2012 plan, it actually built in some degrees Fahrenheit, the range, where you triggered it at a certain excessive temperature, and then also if it didn't go below a low temperature. So that no longer, that fits into the equation, but that's no longer.
It is considered, the high and low temperatures are considered as part of the National Weather Service's experimental heat risk product. So we're no longer relying on those very specific thresholds. We're relying on the product distribution from the National Weather Service.
So what is the lowest high temperature that could actually trigger you into this calculation?
I don't know precisely the lowest temperature, but I can tell you that it is seasonally adaptive.
Oh, okay.
And that's the local climatology portion of that. Basically, in the shoulder seasons, we will see heat warning products come out at lower temperature thresholds if there's longer duration. And the heat risk model will go to either red or magenta at lower temperatures, let's say in May, than it would in July when people have had an opportunity to acclimate to those temperatures.
Okay, that helps. That's very useful. Supervisor Kennedy.
Thank you. This is pretty fascinating as far as taking into account more things than just a temperature, and I can see why they work. I guess bottom line, I hate to get ahead of your presentation, but what I would be interested in seeing, and tell me to shut up if you already have a slide that says this later, is that in 2021 under the 2012 plan versus the 2022 plan, which one would have put people into a shelter situation or a warming and cooling situation more?
So I went back a slide. In 2021, we were at our old plan thresholds for this. So you had 105 degrees on Friday and 99 on Monday.
No. What I'm asking is, let me be more clear. Over the course of the year, under the old plan and the new one, I know the new one wasn't in place, which one would have gone into effect more often?
The new plan will have gone into effect more often.
Okay.
We used it last week.
Yeah. But I'm looking for more than a larger sample.
On average, over the last 5 years, there have been, on average, 8 heat warnings per summer season from the National Weather Service. That can vary and be 12 warnings, 0 warnings. But on average, over the last 5 years, we've had about 8.
And we don't have the analysis that if we were applying the new criteria of what that would have been.
I can work with the National Weather Service and get you an analysis.
That would be
if that's
very
what you'd
helpful.
like. Okay.
Thank you.
Just one follow-on question, because again, it occurred a few summers ago, and it was coupled with a very hot period. But when we had the fires and the smoke really laid in Sacramento County, and we got some very high readings relative to the toxins and so forth, but in the conditions for folks that had with asthma and other compromised breathing capacities. But does that get factored into, because the smoke, again, it can hold the temperature down, but it can also hold the heat in longer. So does that get factored in there? I mean, cloud cover can have a similar effect. You might not get to the, and I see Courtney shaking her head. Yes.
Yeah.
So I guess curious, so does it takes into account those factors too?
It does, and we've worked with the Public Health Office and the Sacramento Air Quality Management District.
Yeah. Okay, good.
They're actually working on a plan for our area that we've been participating with them on. So has the Public Health Office. And we do have criteria when smoke is impacting the county on when we would open up what's called a cleaner air center. Okay. And so we have some guidance and some policy around that when we would open, which is slightly different than a cooling center. But what we've seen in the summer conditions is that they're often intertwined and opened together.
Okay. But it could be separate as well.
They could be separate. If we had a smoke event without a weather event, we would open as a specifically cleaner air center. And I can't remember which year, it might have been 2020, where we opened a cooling center first and then transitioned to a cleaner air center.
And that's a separate annex, the clean air?
It's right now a separate document. It is. I promise I won't bring absolutely everything to this board's consideration. But that is a separate set of guiding documents that we're working through and that Public Health has really been leading.
Okay, very good. Thanks. Okay.
So I wanted to talk a little bit about new data that I personally have been quite excited about because I feel it allows me to make better decisions when it comes to determining whether or not to open centers. And that is the probabilistic data that the Weather Service is starting to release. So we have been a beta test partner with the National Weather Service Sacramento office on utilizing this data, which still, in my understanding, has to be done by hand. So we're very lucky to have this partner information. But what is new to the cold elements of the plan, and will be incorporated a little bit with heat as well, is the probability or likelihood of reaching certain temperatures. So in our past plan, we would look for forecasts of 32 degrees or lower for cold weather temperatures. And often we wouldn't see it, or we'd be right on the cusp. It would be 33 or 34, 35 degrees. This plan, basically, when it's 35 degrees forecast for 3 days, we're going to start our weather calls with our stakeholders and partners. And if we see forecast temperatures at 32 degrees, or if the National Weather Service is telling us that the probability of reaching 32 degrees is greater than 50% over 3 days' time, then we'll take action to open warming centers. So this allows us to have a little bit more certainty with our actions because we are committing resources when we do open these centers. So that criteria in comparison, the 2012 to the 2022 criteria, basically what we have added is that additional probabilistic information where any of that information at 50% greater chance, 50% or greater chance of happening at 32 degrees or lower for 3 consecutive days. It just gives us more time in decision making. And I also wanted to bring to the board's attention a slide that you have seen before in our continuum of sheltering services. So sheltering, again, is just one small part of what we do when it comes to weather emergencies. But there are actions that are taken by many departments during normal weather considerations. And in significant inclement weather, many departments will take additional actions. I know that's really tiny and hard to read, my apologies. But a lot of the actions that DHA will take will include additional weather monitoring. They'll provide outreach and motel vouchers. And that motel voucher program has been highly successful compared to the low rates that some of the cooling and warming centers get in terms of utilization. And that is my last slide. If there's any questions that you may have, I just wanted to let you know that we are asking for your approval to adopt these 2 plans. And I will allow questions.
Great. Thanks, Mary Jo. Well, thank you for your presentation. Thanks for our friends from the National Weather Service. Probably your first time here too, Courtney, is it? And so we welcome you as well. Board members, any questions of the presentation? Seeing none. Any callers?
Oh, sorry. We do not have any callers.
Okay. All right, so we have a staff recommendation before us.
Move adoption.
All right.
Second.
Moved and seconded to approve the staff recommendation adopting the operational area extreme heat and extreme cold hazard annexes. And with that, thanks to all presenters. Please vote.
Unanimous vote.
Very good. Thank you all. Okay, next item.
Item 6 is to adopt the Public Safety and Justice Agency Advisory Committee charter.
Okay, Mr. Jones. Hi, Eric.
Hi. Good evening.
Good evening.
Yes, good evening. Chairman Natoli, Board of Supervisors. So Eric Jones, Deputy County Executive for the Public Safety and Justice Agency. And I'm bringing you this evening a framework in the form of a charter for an advisory committee for the PSJA. I'll be using that term, but that's the Public Safety and Justice Agency. So I have a PowerPoint we'll be going through as well. Okay, so general role and responsibilities. First, a recap of the PSJA. It's about lead responsibility for the county's roles in the criminal justice system from the CEO's office perspective. So this is to oversee departments of the coroner, public defender, conflict criminal defender, and probation, but also acting as a liaison directly with the sheriff's office, with the district attorney, as well as the law library, and coordinating with the Office of Inspector General, Superior Court, Criminal Justice Cabinet, and the Community Corrections Partnership. And a role of PSJA is to direct and coordinate activities of related advisory bodies. And as you know, there are a number of well over 70 county-wide bodies, committees, boards, et cetera. About between 10 and 12 are criminal justice related. And just a couple examples, and you've heard about them a lot through the budget process or otherwise. The Community Corrections Partnership, CCP, the CCP's Advisory Board, Criminal Justice Cabinet and their work groups, the PHAB or FAB, Public Health Advisory Board, the Alcohol and Drugs Advisory Board with the Criminal Justice Committee, Mental Health Advisory Board with some subcommittees, et cetera. So there are quite a number of those. And really what we're looking for here is something coming from a different place, but also very important, as you, the board, talked about back in August and again in October, was that this office, this agency, look through everything we do with the lens of race and health equity. And the reason I'm here now is to provide a community input structure to you as a Board of Supervisors. And the reason is it's so critical that we get the community voice in ways not heard from before. So it will be a bit unique, which I will cover in a bit more detail. Most importantly, really, I believe, is this is hearing from individuals with lived experiences from a variety of backgrounds. So the purpose for the committee, again, as mentioned in August, was to really get direct community engagement for the PSJA's goals. And those really four key goals are reducing adult jail day population, reducing recidivism, increasing services, and increasing efficiencies in the criminal justice system. I'm actually going to put all of these up here. Okay. And again, back to that history, on August 10th, 2021, there was a resolution that established the Public Safety and Justice Agency, and it added for county staff to come back before you back in a separate resolution with a proposed committee structure. And again, in order to allow for community collaboration and provide community voice into the dialogue around those really four key priorities that were mentioned.
And that's what you're bringing us today. So from the direction that came out on August 10th, this is what you are recommending to us, but we haven't acted on anything in between that time and this time. We talked about in October about wanting to see it happen, but so this is that follow-on recommendation through
correct,
the
Chair.
county executive's office. Okay, thanks.
Yes, the direction was to bring back a framework specific to an advisory board for the Public Safety and Justice Agency. Yes, and so since then, months of work have gone on, really a lot of various discussions I've had with individuals, agencies, organizations, really to see how is it that, what is the mechanism going to be in the structure so we can get that community dialogue. And that's what I have for you here today. So for this advisory committee, really the authority of the committee, as mentioned back in August, it is advisory, and it's advisory to the Public Safety and Justice Agency. So this is one of those unique factors I mentioned. This is actually an advisory committee to county staff. And so the county staff will be myself and then representatives from all of the various criminal justice agencies within the county. And then the responsibilities will be really for the agency deputy county executive to, through the CEO, report the committee activities back to you as the Board of Supervisors on at least an annual basis. Okay. So here we get into the actual structure, proposed structure for you. And really the charter here, and that you have attached in the board with the board letter, it outlines the deputy county executive as the chair, meetings being at least quarterly, agenda item processes, as well as that these meetings will be closed to non-members. And these are a few key points. I want to spend a little bit of time about this section about it being closed to non-members. There are a few very important reasons for that, in my opinion. Like I said, by design, this is different than many of the other criminal justice and public health related bodies that have numerous avenues for public input. And I don't want this body to be duplicative of that work, that great work that a lot of our various already existing bodies are doing and will continue to do. Also, this one is unique in that this committee will be advising county staff directly, and that community voice in this case are very personal stories. So what I mean by that is I think it's important that county staff really have the ability to hear honest, open, deep dialogue about issues very near and dear to the variety of backgrounds that we're going to have at the table, so that criminal justice leaders can make thoughtful decisions on policies and procedures based on those very personal stories. And I do have feedback from a variety of organizations and individuals that really felt as if they haven't really had a seat at the table for a variety of reasons of various boards and commissions or have chosen not to because their stories are so personal. And also, I believe it to be a best practice for this type of very, again, unique type of advisory committee to be able to have those deep discussions, to be not open to non-members. That does not mean there cannot be public workshops tied to this committee where we can hear from all of the community and all of the public, but for the regular standing meetings, that is what's proposed before you here. We're really looking for a cross-section of representation and to ensure we have as much of representation from these variety of groups here. The committee will have up to 15 members, comprising, again, of most of these areas. And so we have behavioral health, medical and public health, civil rights organizations, educational field, mentors, formerly incarcerated individuals, crime survivors, recidivism reduction organizations, clergy, and business owners, neighborhood associations, as well as philanthropic organizations. The members will, as proposed, serve for a 2-year term on this. Now, there will be leads or representatives from every criminal justice organization in the county, but they will be there as staff to hear from the membership. So the committee members will not be comprised of any actual county agency or government.
Yeah, oh, sure. Somebody does it, right.
Thank you, Eric. I appreciate that. So that the departments that you directly oversee will have representation. What about any of the agencies? I didn't see the agencies that you liaise with, sheriff, DA. I mean, what were your thoughts about that?
My thoughts are that they would also have representation. I think
But
it's
not
very
be a member of the advisory. Got it.
Absolutely. So, for example, the 4 specific departments that I oversee, probation, coroner, public defender, et cetera, will be there, but as well as we need representation from the district attorney's office, from the courts, as well as the sheriff's office.
So I have a follow-on question, and again, I don't want to get ahead of your presentation, but, and I know that, certainly you'd briefed at least this member of the board before the printed information came out, so obviously I had a chance to review that, but, and you've talked about the uniqueness of this, Eric, but I guess I'm still, in my own mind, thinking about, certainly what you want to encourage, and it's understood. You want folks to be, not just forthright, but honest and to share whatever their experience, but their thoughts and so on. But by making this advisory to, our administrative structure, then one, the board is not involved, so therefore it not involved in the sense that we are not making the appointments. I guess you and or a committee of executive staff are making those determinations. But we have a number of advisory committees, and they advise us, and they are under the Brown Act. There is a public setting, and I get it that you want to maintain some. I don't know if it's confidentiality, because if somebody's going to share it in a room of 15, including county staff, that's not really a confidential. It may be a closed door, and so it's going to be very, very filtered back to this board. Again, and maybe not advising us directly, and we do have other structures that advise this board, but I don't know. That kind of has a bit of a veil, and I'm not saying secrets. Just a bit of a veil attached to it. I mean, and I assume that's intentional. That's my word, not your word. And I think in light of a lot of what we're trying to achieve in this county, certainly in looking at our service delivery, looking at the challenges we face for the general population, but certainly for specific segments of our community and our in populations. You want to have good advice. You want folks that are going to be, again, candid with you and be willing to participate. And yet, everything that comes back to this board will come certainly via your professional role as the county executive. And I don't know. Again, the charter. I'll say this: that when we had this conversation, 10 months ago, again, not knowing, it was my predetermination as one member of this board, an advisory committee structure along these lines. Certainly, I want the cross section of representation. We want that to be real. I don't know that if you'd asked me then, and I'm going to say it right now, is that to say that was just going to be this closed door advisory committee that will be broad enough. It'll certainly have a county representation there, but it won't be open. And again, that challenges me a bit in my thinking about this. Not certainly even respectful to what you're bringing us, to the thought that's gone into this. And in fact, we have other opportunities for folks to participate. I don't know. It just seems kind of a bit of a half step in the right direction, but I'm not. Again, I haven't had a lot of experience in that regard, and I understand committees and their ability to work, and you can roll up your sleeves. You can be a little more free flow discussion. Nothing wrong with that in the right setting. But I think in light of kind of the focus that's on the issues that are encumbered by the agencies and the amount of resources this county puts towards it, the amount of community interest from a lot of different perspectives. Again, I wanted to share that because, again, as I thought about this, and we haven't had a conversation since we briefed about it, and I'm respectful of what you're bringing us, and certainly going to listen to you and to the reasons why. I hear from my colleagues, but again, if you'd asked me in August, is this going to be? I would have said no. It'd be a Brown Act committee. People will be able to come into the room together, and certainly how those folks are selected, how they serve. That structure was all kind of left open. I guess this is just a little different than what I would have maybe expected. So,
yes, Chair, absolutely, and that I guess that is the point I bring before you. That it is a bit different because we do have the recently developed Community Review Commission, direct oversight. We have the Criminal Justice Cabinet. We have the Community Corrections Partnership to get public feedback regularly, and a variety. And I guess I would specifically say I heard from mostly crime survivor groups, Justice Center, quite a few, that said this is one thing that's been missing, is to be able to have those very intimate, personal discussions. And that it'll be reported out on the themes, the things we're talking about, but not the individual personal stories. And that's been one thing that's precluded a number of, to get the full diverse background of those who have some sort of, have been deeply impacted through some point within the criminal justice system that's been, has kept them from coming to publicly speak in some other areas, or they feel that there are certain groups, organizations that sort of take over other bodies that have made them uncomfortable. I've heard a variety during my own listening sessions, and that's why this was specifically crafted this way, not to take away from the other very important bodies that are open to the public and very much public input and meetings open to the entire public.
Yeah, I was just going to weigh in as well. One of the groups that's been historically missing from our criminal justice committees and advisory bodies that are Brown Act committees is the voice of victims. And I think that it's a critical voice that has been missing and that we need to include it. And I think that doing it this way will allow victims to feel more comfortable in participating. And I think that's why we're proceeding in this way.
Okay, Supervisor Frost, thanks.
Well, I just wanted to share from my personal experience, Supervisor Natoli. I appreciate that you've been sensitive to the crime victims. I have, let's see, I have a relative, I'll say, who someone broke into her house and held her at knife point, and he ended up going to prison, and he threatened to kill her when he got out of prison, and it literally changed her. It changed her life in a drastic way for a while. I mean, and I think your sensitivity to the crime victims is really important, because there are different kinds of victimization. There are inmates that are victims. There's also crime victims. So there's two sides to that story, and I think it's really important to have the wisdom of both sides, all sides. And so I appreciate that you're even in that room with all those people. It might be hard for them, the crime victim, to share, I would imagine, knowing what I know. So I appreciate that you're sensitive to that, and I support the privacy so that they can actually all have that conversation, that deep conversation. Thank you.
Just a quick response. I mean, I've thought about this a bit. That again, you want folks to consider participating. They still got to go through a vetting process. It sounds like you're going to be making the appointments to the committee. You've offered assistance from a group that you have confidence in to review the applications. But again, you want folks to think about participating and to do that in a way that obviously is sensitive to whatever traumatic or bad experiences or terrible experiences they've had, to inform this broader discussion. But on the other hand, it's, no secret. You're going to come into a room with others from other backgrounds and viewpoints. You're going to have, lead county agency representatives in the room. So this is not, I say, there's a bit of a veil. It's a veil to, I guess, a broader public viewing of this. But nonetheless, you're still, if you're going to go out there and tell your story to, with Supervisor Frost, to inform others about, impacts and considerations, it's, if you're going to step forward and offer your time and guess into bear some of that story, you're going to acknowledge that going in. I mean, if that's what you choose to do, nobody's forced to say anything at the meetings, I guess. So again, I'm puzzled about this, and again, I can understand the implications and maybe the hesitancy for what you've stated and, maybe what Ann said as well and Sue explained, but this, you're going to, anybody who's going to volunteer to serve and if they're selected to do so, I think has to know that if they're called upon to share and if they choose to do so, 15-member group is no small group, plus other folks, closed door or not, you can have, you maybe have 25 or 30 people in the room you're going to share with. And I guess if you're comfortable with that setting, irrespective of the points of view that are represented there, then you'll contribute in the way that you choose to do that as a member of that committee. But again, I wouldn't see it as being something where people are going to, think that they're going to go in there and tell the story. And, if they want people to hear it, then you're going to have an audience there of colleagues, peers, and others. So, County Council.
Can I ask the board to take a 1-minute recess? I need to confer with the county executive.
Sure.
Sorry.
Okay. We'll take 1 minute enough. How about we take 5 minutes? We've been here for 3 hours, so 5-minute recess. I call the Board of Supervisors back in the session after a brief recess. Better call a roll to establish a quorum, please.
Supervisors Cerna?
Here.
Kennedy? Desmond? Frost? Here. Natoli?
Here.
And you have a quorum.
Okay. Going to resume where we left off, or is there any need for any follow-on from council?
Not at this time. I think we can finish the presentation, then go
Okay,
from there.
very good. Okay,
Thanks.
good. Thank you, Lisa. Thanks, County Executive. Eric, back to you. Thanks.
So this was the proposed membership process is that candidates, interested candidates, would submit their interests through a member applicant form, basically given their name, contact information, organization they would be representing, to be a resident of Sacramento County. And then I would review these, but I would utilize the Alliance for Safety and Justice. This is actually what they do, and this is their area of expertise nationally. Is to bring groups together for these very difficult, sometimes fragile, but very important discussions to really form what they call a blueprint for shared public safety. And then after that process with...
Sorry, Eric, pause. Supervisor Kennedy, right at that point.
Just for a little bit more view into that, who they are other than a national organization. I mean, could you just expand upon that?
Yes, so the Alliance for Safety and Justice is a nonpartisan organization that works all across the nation. They have a California branch called the Californians for Safety and Justice, and they work on a blueprint for shared public safety, which is having the voice of all of the various segments of the community to come together and talk about really a couple things: how to make communities safer and how to reduce the harms that the criminal justice system has done and can do. And so that's their area of expertise.
Thank you.
Do they have just a statewide branch? Or do they have a local branch? I know some of them weighed in here at one time. I think you sort of called in, and maybe some were here. Do they work in specific communities, or is this a statewide organization based out of Sacramento, or where?
So they're actually based out of back east.
Oh,
is
they
their
are. Okay.
headquarters.
Okay.
So they do have the California branch, which is Californians for Safety and Justice, but their national organization is based in either D.C. or New York.
Okay. And where's their statewide branch based out of?
They have one in Los Angeles. They do a lot of work in the
LA.
Los Angeles area, and they do have one up here in the Sacramento area.
Okay, very good. Okay,
Yes.
thanks.
And then the county executive or designee would make the final appointments to the committee based on the interest that came in. And the Alliance for Safety and Justice uses a scorecard method to really ensure that on that last slide, we're getting as much representation of these areas as well as the level of interest they have, and then their stated reasons for having interest on being on the committee. And then the proposed timeline would be these next steps. So the member recruitment and application process would take us between July through August, establishing the member roster by the end of September, and then hoping for a kickoff meeting for the committee sometime between September and October.
Okay. All right, thank you, Eric. Questions of Mr. Jones at this juncture? All right, I don't see any more. Then I don't have anybody signed up in the chambers. Do we have callers on this?
We do actually have one caller.
Okay.
Or two.
Okay. All right, if you'll stand by, Eric, we're going to take the calls.
Can you transfer the first caller, please? Hi, caller. Please start with your comments. You have 3 minutes.
Hi, good evening. This is Liz with Decarcerate Sacramento. I just briefly wanted to call in and ask a few questions that I'm still left with after the Mr. Jones's presentation. Thank you. I'm still sitting here I'm personally not clear on what the goal of the committee is. I know that, you say that it's to advise, your agency and to engage with the community, and I'm not sure what that engagement means, and also just overall what the goal of this committee is. And so for years now, the county has been saying it's committed to creating and implementing a comprehensive jail population reduction plan. And unfortunately, I don't believe the county has accomplished this yet. So our hope was last year in August when we worked so hard to make sure that the creation of this new agency with the stated goal of jail population reduction included a committee. We imagined something a little bit different from this because, we really wanted to look at other counties and what's been successful there. And we really noticed that, like the ATI working group in LA County, for example, was public meetings brought together all relevant stakeholders and community members to really come up with a plan, an actionable, measurable plan for each county department on what prevention policies and what actual policies can be implemented that will result in a reduced jail population. And so I also just wanted to say, as a crime survivor who's also lost family to homicide, I definitely understand the importance of protecting the rights of victims. I also know that you're aware that, there are crime survivors that don't identify themselves as such who are, a part of these conversations. And while I do definitely respect the work of the Alliance for Safety and Justice and Californians for Safety and Justice, they mainly do work on the state and national level. And I wonder why their expertise is being brought in so heavily in the formation of this committee, when a local organization would be more likely to be more appropriate, given their specific knowledge of the Sacramento County ecosystem. And I'm also wondering if the Alliance would be paid, and I know you have a previous existing relationship with them, Mr. Jones, so it's just a little confusing to me. But yeah, I really just want us to ask ourselves what the goal of this committee is and what it will accomplish. Thank you.
Thank you, Liz. And we'll get Mr. Jones respond after we heard from the callers. So you just, we have other callers?
Yep.
Okay.
Next caller, please.
Yeah,
Sorry.
let me say, would you prefer to respond in between callers, or we want to just hear from the callers, Mr. Jones? And
Your preference, Chair.
okay. All right, we'll take callers.
Okay, sorry. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, Board of Supervisors. Yes, calling in to really ask, because there are a lot of unanswered questions, and just want to lift up what the previous caller had raised in terms of both goals and outcomes of this committee. And I would hope that as the new deputy county executive over this brand new agency that's being created, we are actually, the priority is to create measurable outcomes and goals strategically, and not just within the current culture of Sacramento County government, but actually in direct partnership with community members directly in this. And one of the key questions I have brought up from the charter itself is that, this charter states that the purpose of this committee is to engage with the community, but you all indicate that the meetings will be closed to the public. How exactly will this committee engage with the community without public meetings and making those in compliance with the Brown Act? Second question is, how specifically will advisory committee members be involved in the planning and decision-making concerning the county's jail system? The charter states that the committee will consider, discuss, and assist in the work of the PSJA, but the specifics are incredibly lacking. It leaves it wide open for this committee to just be a performative measure, which nobody, I think, in this board, I would hope, wants that to be the case. Another question I have is, will the board be able to attend these committee meetings, or at least hear directly from advisory committee members themselves on any sort of recurring basis, rather than just, as the charter states, the deputy county executive just reporting on those activities? Because again, shrouded in secrecy, I believe it was brought up by Chair Natoli that it really makes it hard to actually have meaningful engagement with community members if it's all being done behind closed doors. And it's also hard to actually build trust that this agency has the community's best interest in mind when it is being done behind closed doors, of course. And just want to also raise up to, I'm curious to know how this proposed structure will help facilitate a comprehensive jail population reduction plan. This plan appears to be, is that going to actually come from this committee? Or is it just coming from the deputy county executive and a couple of the law enforcement friends? I'm just curious because, this is important. These are important questions that we should be asking publicly to do that. And I think it's relevant that we are setting this committee up right and really making a concerted effort to make sure that as many people, particularly from population, not just from those directly impacted, but also their families, such as for families of incarcerated individuals, as well, to serve on this committee, because a lot of those folks, a lot of the folks that we're hoping to address the issues on, are still stuck inside, and they have no means of actually meaningfully participating within plans to actually improve their own conditions. So these are just a few of the questions that we have, and also curious too. The charter states that representatives from the Probation Department and public defenders will attend committee meetings, but representatives from the District Attorney's Office, Sheriff's Department, and Inspector General's Office are only invited to attend. So I'm just curious if the two biggest law enforcement agencies will be directly involved in managing, who are directly involved in managing the jail system, are going to be required to attend, or if that's simply optional for them.
Okay. Very good. Thank you, Keon. Appreciate your questions and comments. Thanks.
Okay, next caller. Hi, caller. Please start with your comments. You have 3 minutes.
Hi, good afternoon, board. This is Mackenzie Wilson calling with Decarcerate Sacramento. I think I'm wanting to say that I don't believe enough engagement or community input was actually included into this plan. I'm going to preface with saying I think I'm getting a little tired of bringing expertise to this room for free and it being dismissed as sometimes we don't know what we're talking about or that we don't know how to get to programmatic and pragmatic solutions. I will still applaud these efforts, but I really want to point out that this is very watered down and far from what this community asked for. I'm going to read some notes from some colleagues because we all couldn't make this meeting tonight. And it may include some already asked questions, but these things are important, and I look forward to responses and hopefully maybe some changes to this proposed committee. As a friendly reminder, this committee came into being due to our advocacy last summer. We thank you for listening to us. and implementing it. But the current proposal does not fulfill the intention or need for a body to work alongside the PSJA to accomplish its goals. Thank you, Supervisor Cerna, for proposing the specific language adding to the committee promise to the resolution on August 10th of last year. We also hope that you'll advocate today for a committee that will build a comprehensive plan for our jail population reduction. In the PSJA Advisory Committee Charter, it states that the purpose of this committee is to engage with the community. How does the county define this engagement? The charter states that the committee will consider, discuss, assist in the efforts of the PSJA. But where will the comprehensive jail population reduction plan be formed? If not here, then where and when? Can advocacy organizations be included on that list? We see philanthropic organizations, but not advocacy ones, and loved ones of incarcerated individuals could also be added, not just incarcerated folks. Will the Board of Supervisors be able to attend these meetings and hear directly from this committee? Why will the committee meetings not be Brown Act compliant as we asked for them to be? How will the proposed structure help facilitate a comprehensive jail population reduction plan? How will the members of this committee be involved in the planning and decision making around the jail system and jail population reduction plan? Why will the Alliance for Safety and Justice review the committee applications with the PSJA Deputy CEO? Will they be paid for this work? Doesn't it make sense to actually have a more local or familiar with Sacramento County to be better fit for this role? I recognize they have an office here, but none of us know who they are, which means that they're not on the grassroots nor on the ground nor near anybody impacted. Why is the community selection process for the PSJ Community Advisory Committee different from the AB 109 Community Correction Partnership Advisory Committee? For other county advisory boards, the board approves final selection of its members, not the CEO, so we really would like an explanation. Why are certain criminal justice partners invited to attend versus being required to attend? Allowing community to tell you what we think and then doing nothing that we input is not community engagement. In fact, it's tokenizing and it's extremely disingenuous. Listening is not about just checking a box. We're worried that the county will not succeed in reducing the jail population if they continue with the proposed plan as is. We think we would like to take the time to reiterate that the PSJA committee should include all relevant department and agency stakeholders, that it should comply with Brown Act, and that it should be trained in racial, gender, and health equity. Every single member, every single department head, every single person. And for comparison and reference, Alameda County passed a resolution last year that created a Care First Jails Last committee with representations from 9 county departments that is currently meeting monthly. I know that we kind of have that with the Human Services Coordinating Council, but I want to say that sometimes those recommendations don't make it and fall upon deaf ears. So how can we create something that is realistically going to focus and really get to alternatives to incarceration? And then also Los Angeles County created the Alternatives to Incarceration Initiative in 2019. Their meetings are open to the public, and they carried out deep community engagement to create their Care First Jails Last report, which outlines hundreds of specific recommendations for reducing the jail population in LA County. Yeah, that was it. And I'm going to forward this to all of the Board of Supervisors members, just so that way you have these questions and you have these references, and that you have these, hopefully, things that should be 100% added to our PSJA committee. Thank you very much.
Great. Thank you, Mackenzie. Okay.
And that concludes your callers.
Okay. All right. That concludes the callers. I see Supervisor Kennedy's in the queue, so and then we'll go to Mr. Jones.
Yes, just I know that you've been probably taking notes, and judging by your at the podium job interview, I recall you did quite well following the questions, so not too worried there. But the last caller had a good point. Is there going to be a component of cultural competency that we're going to make sure that the members of this body is afforded, if there's any training and so forth?
Yes, that's actually a component that I had already thought of through discussions,
right,
and developing a comfort statement for the entire group and working on that is going to be critical.
Yes, thank you. I just wanted to hear that. Thank you.
Yes.
Okay. All right, Supervisor Cerna. Then we'll go to Ms. Jones. Okay.
Thank you, Mr. Chair. I assume we're now at the point of board discussion deliberation.
Yeah, we are, but Eric might want to respond to a couple of questions that may be relevant to the conversation, if you're okay with that.
That's fine, but I know there's a number of lingering questions.
Yeah.
Some of them very substantive and quite critical. So eager to hear from Mr. Jones, but I would just like to put out there, I think maybe acting tonight might be a little premature. We might want to take the time and continue this item until we can maybe do a deeper dive than just asking Mr. Jones to respond at the podium tonight.
Okay. So fair enough. Okay. Good. So Eric, give you a chance to respond, and we'll bring it back here for discussions about what to do next. Go ahead.
Yes, Chair. I wrote some notes down for a few questions.
Go ahead.
Okay. So regarding the goal of the committee, it's really it's about informing all of the criminal justice system partners, getting community dialogue around those 4 specific issues or wherever they want to go. It's not to develop necessarily the comprehensive jail population reduction plan, but it's to hear ideas on how to hit 4 key areas, which are to reduce the jail population, which a number of bodies are working very specifically on, and staff, as well as, again, reducing recidivism, increasing services to those incarcerated or coming out or on the front end for warm handoffs, and also hearing from the community how on other criminal justice efficiencies we can increase. So that's the purpose, but oftentimes a body like this will dive into one area or another more specifically. Alliance for Safety and Justice is not expected to run this at all. They would be leveraging community partners. That's the point, is to have community, local community work through this. They would facilitate the initial meetings, and they are not paid at all. They receive their funding through philanthropy, through other sources. They would not be paid for this work. A couple other things I think is, definitely open to public workshops, as I mentioned. And the decision-making piece, really, the goal here was for it to be advisory and not actually decision-making, because really that would have to be something for the Board of Supervisors in a lot of the areas where they're considering decision-making. And there was also one other question I wanted to respond to. Was there some wording on who's required and who's invited? The required are those that are under my direct supervision. The others would be, I'm certain I would be able to garner the partnerships from those others. But of course, the Public Safety and Justice Agency, county executive is not in a position to be able to mandate the district attorney or sheriff to these. But certainly we want them at the table, and I think they would be there.
Okay. Good. Well, thanks, Eric, for responding in brief to the some of the questions that were posed. I think that was helpful. Lisa, did you want to add anything? Again, folks want to weigh in here. So
I guess I'll add that I'm not sure what the board's going to do tonight. If you're planning on continuing it, I don't need to explain anything further.
Okay.
But the decision of whether or not this is going to be a Brown Act body should be made at some point, and then the action of the board or inaction of the board will follow. If it's not a Brown Act body, there is no need to, the board should not and cannot create it or direct the county executive to create it. And so that's the issue that we're faced with right now.
And if I just harken back, and thank you for that information, harken back to the resolution. Basically, we said in our resolution, August 10th, create the committee.
Correct.
Come back to us. And,
I'll take that one, Lisa, because that was a mistake on our part. That is what we were conferring about. If this is not a Brown Act meeting, we do not need a resolution, and you will just let us know that you approve of the direction we're going. If you want it to be a Brown Act meeting, then we will have to come back, because we'll have to figure out the mechanism of how you all select members of this committee, because that wasn't considered in this presentation, because we were going to select the members. So if you would like this to be a Brown Act meeting, then we absolutely do need to continue this and come back. If you're okay with what we've presented to you today, then I think we can proceed. We'll have to say with no resolution. Well, no, we still need to.
Well, I think we should just table, if that's the alternative, we can just table this and bring it back if necessary at an uncertain date.
Okay, because again, Supervisor Cerna spoke already about, some unanswered questions. It may go beyond just the Brown Act piece of this. I see Supervisor Desmond in the queue, so appreciate that, at least illumination on kind of what the issue is, and I may have touched on a bit in my questioning prior to the recess, but Supervisor Desmond?
Thank you, Mr. Chair. And I'm certainly always welcome additional discussion. I like what I've heard about the structure, and I guess one question I have is if this board ever wanted to revisit this and convert it to a Brown Act body, certainly this board would reserve the right to do that at some point in the future.
Absolutely. And I meant to say this earlier, but Mr. Jones and I are fully committed to bringing everything that this committee brings to us, to you, even if we aren't accepting some of the recommendations. We'll share with you what was presented, what we're doing, and why. So we'll be completely transparent with you.
Okay. Supervisor Kennedy?
So you said those last few words, we'll be completely transparent. I think you've proven that in just the fact that we're having this discussion today. There's no legal requirement for you guys to set up an advisory committee to staff and bring it to the board. So that makes me feel very comfortable in your commitment to be transparent. So I don't have any problem going forward.
Okay. We've heard a couple of folks. Supervisor Frost, Supervisor Cerna, any additional thoughts?
I can chime in. Certainly, it's not a reflection of not trusting the CEO or Mr. Jones, but I guess I have a little different take than Supervisor Kennedy. I think there's been enough obvious advocate interest, public interest in what we intend to do around decreasing jail population. I think not to have perhaps a more welcoming, public engaged structure, I guess, i.e. Brown Act body, sends a message. I'm not sure it's the right one, but it sends a message of trust us. And I think, we've already heard from a few folks that for their reasons, that they've communicated, there's skepticism of that. So I know that having a full-fledged Brown Act noticed committee it requires more kind of administrative and legal investment of time. But I guess if I were to be asked today which way to fall, I'd go with the Brown Act body.
Okay, very good. Supervisor Frost.
Mr. Jones, I have a question. We do have this committee or this body is an advisory to staff and would advise basically other committees that have already been set up that are working in the law enforcement oversight or whatever advisory. It would be an advisory to us as well, right? And we have other committees that are like this that are not Brown Act committees, but they're in an advisory capacity to staff. Is that correct?
This, Supervisor Frost, this specific proposed framework would be advisory directly to county staff, which is different than a number of the other commissions and boards, which are oftentimes advisory to you. So that would be a key difference on this one. Is this is advisory to the Public Safety and Justice Agency and the Criminal Justice Department leads, and then we put in here that we would report to you at least once a year. But by design, this one was originally not advisory to the Board of Supervisors, rather directly to county staff.
I just want to say that I support the way, the vision that you have for this committee to get everyone to the table and give them a place where they can actually have these open conversations around all sides of the issue of these issues of, not only the inmates, but the victims and the continuum of care and the jail population. And I support continuing this so that we can maybe have some further conversation around it. Maybe we're not quite ready. It sounds like we have some differing opinions, but I lean toward your idea of having this be an advisory to staff and not directly to the board with the Brown Act. And so I would like to make a motion to continue it or table it. I don't know if I should table it. Should I just...
Continue, it's fine.
I'm not sure how much time we need.
I'll just weigh in from the, I guess, legal perspective. If there's a majority of the board that believes that the discussion about whether it should be a Brown Act body or not, we should continue it. If the majority of the board feels like what staff is planning to do on its own without input from the board, then you can just table it or for tonight.
I have a question just to follow on. Supervisor Frost still has the floor, but I know Ann's got in the queue. But so the action in the staff report from August of last year when we took this up, I don't think it declared that it was going to be just a committee that would meet. I mean, this has been crafted over time. It may have been the intent, and that may have been part of it. So that's why my reference a little while ago about the resolution. Does somebody have that language? I don't have it in front of me. What the board directed in the staff report, because we even amended it within the context of the discussion.
I don't have that resolution handy.
Yeah,
either,
it might have
so.
just been staff, or I don't know if it was actually involved in a resolution or not. That's what I'm saying. At least I don't know. But
There was a resolution.
Was a resolution.
And it is our belief that this fits with that resolution, but I don't have it right in front of me either.
Well, I don't have it in front of me, and it occurred to me as we're having this conversation about whether we're comfortable or not. I spoke earlier on about what my takeaway was, without presuming that it was all done
Mr.
and
Jones
said.
has the resolution.
Does he? Okay.
Yes,
Yeah.
sir.
Okay. Go ahead. Go ahead.
Read it.
Well, again, if there's a pertinent part, then yeah.
Resolution ordered, and this is dated August 10th, 2020, or it's referencing that meeting. A resolution ordered county staff to bring back a separate resolution proposing an advisory committee structure that allows for community collaboration, providing a community voice into dialogue on decreasing the jail population, and recognizing the importance of including voices of individuals with lived experiences and those most closely impacted by incarceration.
Okay. So it's basically silent on how it would be conducting. I mean, obviously, you brought your best recommendation and all the justification why, but you said you'll bring back an advisory committee with that intended goals and purpose, as you've stated previously, left it pretty much to, I guess, this discussion right here today about what we're going to do with it. So anyway, I just...
So if I could weigh in
Go ahead,
quickly.
yeah,
So if we, it would be nice to have some direction from you regarding whether you want it to be a Brown Act meeting or not if we continue it, because what we bring back will look different depending upon what your wishes are.
Right.
We'll do whatever you want.
You and Lisa kind of said the same thing.
We need some guidance
Okay.
on, yes.
All right, so...
I just want to...
You still have the floor. Go back to your first.
I guess I'll just say that I would like it to maybe start out as Mr. Jones has presented his vision for this, how it's going to function, and then later, if we find that we need to make it a Brown Act, we could come back and do that. If we find that it's not accomplishing everything in the way that we thought it would.
Okay. All right. And the supervisor... Okay, thank you for that. Supervisor Cerna.
Thank you, Mr. Chair. I'll just kind of maybe expand a little bit on what I said earlier. And I, too, have the resolution in front of me in digital form. And I'm glad that Mr. Jones read from the, I guess, what's the last whereas, correct?
Oh, let me find it here. Yes, I read that portion.
Yeah. Right. So, and I think that that sentence, captures obviously what was intended from the board earlier, but it's, to provide a community voice. And I guess the sticking point I have is what's been proposed. And again, it's not a criticism of staff. I think you were trying to interpret what we directed earlier and come back with what you did, and that's there's no fault in that, and that if we have a slight disagreement in structure at this point. But it feels to me like an advisory body to an advisory body. It feels like you would have an advisory body that informs staff. Staff then comes and advises the board. And I don't know, is the intent to synthesize what is discussed or presented at the committee level? But it almost feels like there's an unnecessary process and use of people's time between the board and the advice, I guess. And it's not a reflection of the fact that I don't believe you would bring back to us your sincere and genuine interpretation of what was discussed or directed, or the brainstorming that might take place at the committee. But I guess it feels a little unnecessary to have it structured that way, and given the spirit of that last whereas, to provide community voice. To me, providing community voice arguably is perhaps best achieved without an unnecessary level of interpretation and advice that eventually arrives in front of us. I don't know if that makes sense to folks or not. It's getting late, but I guess that's where I'm going with this.
Okay. All right, Supervisor Frost. Back
I just wanted to add, did you say that there could also be public meetings? Did I hear that, or it seemed like you said a public process would be happy to work with around this body?
Yes, Supervisor, that's always an option, and probably a good one is to, if it were to hold this framework, to have public workshops on top of this, because it's difficult when there's these would resemble intimate listening sessions. And if there is a Brown Act body, you can't then have them also do intimate listening sessions because you're now a Brown Act body. So that was one reason for this construct. So other options are to have open public workshops for the members to hear from the public. But to make it a Brown Act body and then also have them do private listening sessions would be a violation of Brown Act, and that was a purpose for this. There can be separate listening sessions, and separate workshops are all possibilities for us.
And so you could, I'm thinking about, equity and inclusion and having everyone have an equal opportunity to have a voice, given the differing places that they come from. And if you had a body that could have those private conversations, but that also on a regular basis met with the public, to report, they could even report out. They don't have to say who said what, or, they could give updates on, their priorities or their vision for things, and then get public input that would inform their body even more so than even thought of prior. I mean, this is my thought.
Okay. All right. So I hear kind of different vantage points on this. I would just say and we can entertain a motion here in a moment if that's the desire of the board. I certainly would lean, and again, it may be a moot point because depending upon, as explained by both the county executive and county council, if there's a desire to support the construct that's in the staff recommendation, then that would negate necessarily coming back with any further consideration by the board. But I'll just say that, again, and I said this earlier on this evening when we were some of my earlier questions to Mr. Jones, that I think we are best served recognizing the balance here and not being insensitive to people's, again, as I said, traumatic and life-changing experiences in lots of different respects, and certainly wanting the value that I would hope would be instilled with the formation of a committee that would ultimately, ever how it's constituted, would serve in a capacity that to bring information forward in some format, either directly through Mr. Jones and Ms. Edwards, and or in a different way if it was appointed by this board. I just think the Brown Act, again, I guess in my experience, that open meeting requirements, yes, they can certainly inhibit, as I said, maybe some of the workings, but I think it is designed to, I think, facilitate certainly the community discussion, the community interaction, and I've never in my career found that to be anything to fear. It's not that you want to interfere with good, solid work, and I recognize why the recommendations before us, but my leanings are, and again, if you asked me going out of the meeting on August the 10th last year, I would have told you this is going to be a Brown Act committee. How it gets appointed, and all the things that have been detailed in this charter we're yet to follow on. And having thought about this, certainly heard the comments, certainly comments of my colleagues. I would hope it wouldn't, from the get-go, if we used the open meeting law requirements and did it in that format, certainly working through a vetting of the candidates for consideration by this board. But I think ultimately it's an advisory committee to the decision makers in the county at the top administrative levels and at the board level regarding things that will impact the lives of folks throughout the community, from a public safety and justice and all the various parties that have been mentioned. And so my lean, I lean strongly, I'll say this, towards having the Brown Act apply and figuring out the committee structure, how they would be appointed from there. So that's where I would. And again, it's not for lack of trust for folks that we do trust for very important things, and it's not to confuse the process or make it more difficult. I just think that that's where I land on this. So I've heard the comments. It sounds like there are 2, maybe 3 that were comfortable with the recommendation. We've talked about continuing it, and so I'll go to my colleagues if you want.
Do we have a motion on the floor?
No, we do not. Not yet.
Okay.
I don't believe so. So.
I would suggest that if someone wants to make a motion to continue and bring it back as a Brown Act body, then that would be appropriate. And if you do want to do that, you can. And if you don't, then we don't need any action.
I'll make that motion.
To
continue it and bring it back as a Brown Act body.
Okay. The chair would second the motion. Supervisor Frost, you're punching the cue.
That's all right. I was going to make another motion, but I don't know that I need to make I don't know.
We can talk, motion on the floor, but Supervisor Desmond. Yeah. Okay.
I really appreciate the conversation. I think this is a tough call. I really listening to Supervisor Cerna and Supervisor Natoli. Excellent point. I mean, it occurs to me, we have an awful lot of these advisory committees. We don't have a forum like the one you're trying to design here, and I do know that if you start down this road with this framework, we can always come back. I mean, we could always come back and revisit the decision we make or don't make, and go to a Brown Act committee at that point. So that's where I am with this. But it's a close call. I really respect the comments of my colleagues, but I prefer the framework that you've set out. I think that's a good way to start anyway. So
is that a sub motion?
No, there won't be a motion. There wouldn't be a motion for
okay.
that. It would, if you don't agree, just
vote no.
if you don't agree with
It
taking
defaults.
it back and having it be a Brown Act body, then it will just default to staff's recommendation, which does not require, does not require action at this time.
Okay.
Okay.
All right. So any further comments from board members? Everyone's had a chance to speak. We do have a motion on the floor. That is to continue and to bring this back in the Brown Act format. Please vote.
And the motion fails with Supervisor Kennedy, Desmond, and Frost voting against. It's
Okie dokie. Very good. All right. We'll move on from this item. We do have one other item. We thank our folks who have been in the audience on the item continued from yesterday. So we'll move to the last item besides appointments for the day. So go ahead.
second to the last item.
Yeah, second to the last item.
Item 7, approval to establish a new fee structure in line with the revisions set forth in Section 26190 of the California Penal Code for concealed weapons permit processing fees as required by California State Assembly Bill 1297.
You got to hear about a lot of other stuff besides what you were here to present on. So
I did share, but it was very interesting. It's a lot of good discussion.
yeah, thanks for
that
being
goes
with us.
on in here.
Okay, go ahead.
Of course, sir.
Yeah. So you're back, and I guess we want to summarize since we kind of tasked you with coming back as relates to cost recovery and so forth. So I don't know if you wanted to summarize that in your verbal comments.
Absolutely.
Okay, go ahead.
So basically, before we went anywhere near adjusting the fees, we had county council review the language in the applicable penal codes to get a little clearer interpretation and to make sure that our interpretation as an agency was in alignment with theirs. And basically, county council's opinion is we cannot stack fees that are not applicable to the process. So in this instance, the board asked us, the only way to do a full cost recovery would be for us to go outside of what the actual time and cost associated with that time it takes to process a new application fee, and then take the additional time and cost it takes to process renewals and modifications and stack those costs all onto the new application fee. So basically, the answer is we cannot, at least county council's interpretation is we cannot add those fees knowing that this cost study was accomplished and that we were very specifically associating the fees with the particular processes. In addition, we're chained to the other language in the penal code, which discusses what we can charge for the modification and the renewal fees. On top of all of that, with the application fees is the CCW process in and of itself is there's an initial application fee, which is 20% of whatever the fee we're charging in the moment. There's cases on a fairly regular basis where the applicant fails. So while the time may be exactly or close to equal what it would take for somebody whose application was approved, and the costs incurred with that, we would not recoup any of the monies other than the initial 20% that we collected. So there's a lot of moving parts to it that make it really difficult to do as the board directed and try to figure out how to get to a full cost recovery.
Thank you for that. County councilors, you want to weigh in at all on this? I think she summarized it, but just
Yeah, I think she summarized it appropriately and accurately based on our research and the nature of the new permits versus the renewals. And the last part is also very key as to how we aren't able to really recoup all of the costs.
Okay. All right. Supervisor Kennedy.
Not disagreeing with anything that's been said, I just don't understand it. So I just for some clarification. So the 20% is the most we could charge if the person fails for an application fee. Is that what you said?
Well, the way it's structured is you can collect 20% of the fees up front on a new applicant.
Okay.
So when you initiate the process
So
to get your
20%
CCW,
of the three.
of the entirety of
That's
the fee.
the most that you can charge for an application
On
fee?
a new applicant, yes.
Is
the
that
most
because
you can-
it's penal code? I mean, that's specifically in penal code? I mean, because, I won't use the word arbitrary, but we, have different application fees for different departments and all that. Is that because this is specifically housed within this particular?
Yes.
Okay, thank you.
Okay, Supervisor Desmond.
So really, the only way, thank you, Mr. Chair, the only way we would be able to realize full cost recovery is if there was some kind of legislative change, right? Is that
Yes.
the position of?
Which is kind of ironic because there was a legislative change.
Yeah,
and
and
it didn't
that's
really,
what they were striving
It didn't
for, I
really
thought.
work.
Yeah, that was the legislative intent.
Right.
Right.
Yeah.
Well, that needs to change because I full cost recovery is extremely important in this context and in so many others. So
Right. So, I mean, that's something we can add to the list of things to
for
explain.
our legislative agenda. Thank you.
Okay. Other questions? All right. So if there are none, then we have before us the staff report with additional information that was proposed last week when we put this over. Just one question. So we fall about $125,000 short of full cost recovery. Is that accurate?
It's an average. So again, because there's a lot of factors we can't predict. For example, if all of a sudden we had a year where we had very few new applicants, which is where we're actually recouping the costs, and we have a ton of renewals and modifications, it could tip it a little bit. But it's a fairly, and Jennifer can probably speak to this more if you need a more thorough explanation, but there's a lot of...
Some variables, and you've explained that. How many CCW permits are currently active in Sacramento County?
As of the end of June, we're right about 10,400, give or take a few.
Okay.
Is that a lot?
It depends on who you want to compare to. So I actually have just some overview numbers of some other counties, if you're interested. Sure. So Placer, and this is like by no means an expert collection of things. This is just my CCW staff using internal contacts to get some general figures to give to you.
Hopefully it's based on population, I hope.
I don't understand the question.
Math up here.
Per capita.
Sorry, Eric Jones, Deputy County Executive. These are total numbers, right?
That's not gonna be
regardless
very
of the
informative.
population that you're going to give us?
Yeah.
The total numbers?
Yes, my understanding is these statistics are reflected the same way we collect them, which is when I tell you there's 10,400 and some odd current active CCW holders, that is the number for Sacramento County.
Yeah, but the point, and I'm not trying to be argumentative, what you're going to recite, if it's just the total per county, is not, at least for me, does not inform me on the.
Agreed.
You know,
I'm still curious.
On the comparative level of permits, unless it is per capita, because that's the equalizing denominator, numerator, whatever it is, so that we can have a better comparison. So if you were to compare us to Alpine County, which has 1,200 people, we have 1.5 million, and you tell me, well, they have 3 people that got concealed weapon permits, the math is going to tell a very different story. So then if you just relied on telling us the total figure, does that make sense?
It does. I guess what we were thinking is that at least based on the size of the county, it gives you a ballpark of how we compare. So, for example,
No, we can infer. I mean, if you're gonna, I think you were just gonna start with Placer, right?
Let's hear it.
I was, but I mean, certainly we can
calculate
this out.
But my point is yes, we can infer that if a Placer does not have 1.5 million residents, you're going to give us a number. It's the total number. I'm going to guess it's going to be a lower figure than us in terms of the total comparable, but it really doesn't tell the whole story until you tell me how many people are in Placer County. Does that make sense?
It does.
Yeah.
So if that's what you want, though, I cannot do that in this.
416, 326.
Okay. All right, so give us the numbers.
Thank you.
Go ahead. Thanks. Go ahead.
Okay, so yes, you would like to?
Yeah, absolutely. Let's get everybody
Chair.
curious here.
So Placer County sits at 7,600. Amador, 2,500.
How many folks in Amador? No, 50.
I apologize for creating so
Probably
much work
about
for you,
60,000.
Supervisor Kennedy.
Yeah. I'm sorry, go ahead. You keep
Okay.
going.
El Dorado is at 3,800. Solano's at 3,000. And then when we look at some of the larger counties, Riverside sits at 18,000. Orange County is at 17,000. Fresno County is at 14,000. Kern is at 11,000. And then Sonoma is at 1,000.
Do you have Alameda?
No.
How about San Francisco?
No.
Okay.
That's interesting.
This is based on the contacts we have, that we have either worked with or have somebody in that office that we can call. So it wasn't intended.
Yeah, no, I understand. But of the counties that you cited, many of them are rural counties. And I'm suspecting, and some are, some are not. Riverside has both rural and urban. But one of the surrogates that we use a lot to compare ourselves to, meaning the county for a lot of different purposes, population-wise, include Contra Costa, Alameda. They're urban counties. So that's what I would look to in terms of trying to find a per capita number for those particular counties as a apples to apples.
Absolutely, sir.
Yeah.
Well, thank you for sharing that information, though. Again, that's, I think it's illustrative, though, obviously, of those counties that, you had information on. And you could certainly, I guess, reach out to all 58 counties and see what they did. We're not tasking you with that, but unless that's what somebody's request. So, all right, any other questions about that? Yeah, I'm sorry, Phil. Go ahead.
No questions. Thank you. Appreciate it. I just want to be clear. I'm going to vote no on this, but I want to be clear as to why. It's largely a protest vote because I just don't believe philosophically, I just don't believe in the practice of liberally issuing carry concealed weapon permits as much as we do here in Sacramento County. And I understand, through the legislation and penal code amendment or the applicable penal code here, I get what the legislation was attempting to do, but as was kind of alluded to by County Council and some of my colleagues, it's imperfect, I think, at this point. And so I'm really going to be voting no because I just don't think that especially if we can't really genuinely cost recover for something like this, it's definitely not anything I can support.
Thank you. Supervisor Kennedy.
Thank you. I do not disagree with anything Supervisor Cerna said. I think he and I have been on the same page of this issue for quite some time. I will be voting yes just because I want to raise the fees, but I also fully intend to reapproach our assembly members and see if we can get this thing fixed. So,
Okay. All right. Do we have any public comments on this item, Flo?
We do not.
Okay. No incentive in the chambers. So entertain a motion.
I'll move approval.
Okay. Chair would second it. Approve the recommendation as outlined with the change in the fee for this item, linking it to the CPI, I believe. All right. If there's nothing further, then please vote.
And the motion carries with Supervisor Cerna recording a no vote.
Great. Thank you for staying all afternoon long. We can't really get a chance to talk. So.
Thanks for your patience.
Yeah, thank you very much. Take care. Okay, down to our appointments, and then we'll get to closure here.
Okay, so for your appointments,
Nominations.
let me know when you're ready.
Okay, our nomination, excuse me. Yeah.
Okay. All right. You are continuing to July 12th. The Sacramento County Behavioral Health Youth Advisory Board, continuing to July 26th. The Building Board of Appeals, Carmichael Old Foothill Farms Community Planning Advisory Council, Cemetery Advisory Commission, Cordova Community Planning Advisory Council, Developmental Disabilities Planning and Advisory Council, In-Home Supportive Services Advisory Committee, Local Child Care Planning and Development Council, North Highlands Foothill Farms Community Planning Advisory Council, Orangeville Community Planning Advisory Council, Public Health Advisory Board, Rio Linda Alberta Community Planning Advisory Council, Sacramento County Commission on the Status of Women and Girls, Sacramento County Treasury Oversight Committee, Sacramento Environmental Commission, South Sacramento Area Community Planning Advisory Council, and the Vineyard Area Community Planning Advisory Council. Your first item is the Assessment Appeals Board.
Chiefs of Staff recommended nominating Lawrence Myers and continuing the remainder to August the 9th.
Civil Service Commission.
As District 5?
Yes.
Yeah, would nominate for reappointment Bruce Nelson.
Okay. We have the Delta Citizens Municipal Advisory Council.
Would continue that to August the 9th.
Okay. And Disability Advisory Commission.
Chief of Staff recommend reappointing Carol Moss, Angela Talent, Kathy Sachin, and then continuing the remainder to August the 9th.
Fair Oaks Community Planning Advisory Council.
Please continue to July 26th.
And Sacramento County Employees Retirement Board.
I know that Supervisor Kennedy weighed in on this, and I think he's punched in again on this. The Chiefs of Staff do recommend they'll continue to July 12th. So, Patrick, I'll...
Thank you, Chair. I appreciate that.
Yeah.
Kind of new territory for my 8 years or 7+ years in when this happens. But, you know, again, I want to show respect for the process. I want to show respect for the Chiefs of Staff. But we keep continuing this item when we have an applicant who, you know, used to run, was the general manager of the $7 billion Los Angeles Retirement Fund. You know, and we keep continuing it. You know, I'd like at some point to have if it's the board's desire not to appoint Mr. Agualo, then, you know, we need to vote on this. You know, it's just, I'm a little bit dismayed at the way that we're treating this applicant, who is clearly qualified. So, and like I said, I mean, this is new territory. I've never had this happen with appointments. We usually go along with the chiefs, but I just want to protest the recommendation at this point.
Well, and maybe we can just parse it. We're talking about 3 weeks here, but we certainly, I think, respecting obviously your comments, and obviously there's been an interview conducted. So maybe during the recess we can have, you know, as you asked us, I think I certainly have looked at the application. I know you requested it of your colleagues last week. So unless there's any disagreement, I would support continuing. But I think to your point, expect that on July 12th we would take this up.
I appreciate that.
For
Thank
consideration.
You. That's fair. Thank you.
Okay. All right. Okay, next. Do you want to hold that to July 12th?
Yeah, no, I was just making a note of that. You're expecting a nomination, though, on the 12th,
Yeah,
correct?
that's on the board to do that, yeah.
Sacramento County Mental Health Board.
Please continue to July 26th.
Okay.
And are you amenable to that for the other two? Those aren't district specific. There's 2 other seats.
Oh, there's 2 other seats?
Yeah.
I'm sorry.
Are you okay with going to July 26th?
Yes.
Okay.
Sorry, I didn't have it in my notes, I'm sorry.
No problem. Sacramento County Youth Commission.
Mr. Desmond.
Please continue to July 12th.
Got it. Okay, and that concludes your nominations.
All right, well, very good. That takes us to close of business. This is our last session for 3 weeks. And I know we've had budget and 2 long days, and certainly appreciate my colleagues' patience, certainly Ann and all of our clerk, and certainly county council and everybody who's joined us. Mr. Jones is the last other remaining staff member here with us, but Ann, I don't know if you want to offer some
I have one thing to say tonight, and I was quite remiss at the end of budget hearings when I gave a huge shout out and thank you to a whole bunch of people, and I left out our clerk and her staff.
She got 106.
She got all the
accolades. She got her money and her staff.
I've never seen taxpayers more eager to spend for us to spend their money. I mean,
but I think that's indicative of the job that Ms. Evans does every single day, and keeps us all on point, and so I just didn't want to leave the end of the fiscal year without commenting on what a great job she does. So thank you, Flo.
Great.
And I hope you all have a wonderful break.
Thank you, Flo.
Thank you. And it's really the team, all of the clerk of the board team. Yeah, they're the ones that make it all go.
Totally agree. It's why I forgot which meeting it was, but it was one recent long, difficult meeting, and I felt compelled to actually post a hearty thank you to you and your staff on social media. So
Thank you. Someone actually took a screenshot of that and sent it to me.
you could use it, whip it out during your review or whatever. So.
Right. You
Thank you.
You got a fan club. They call in regularly. So. Yeah.
Thank you.
Okay. Anything else? Okay. All right. Colleagues, anything for the good of the order?
Thanks for your leadership during the last several weeks.
You bet. Well, and thanks to all of you. We're going to, time we come back, we round in the corner and heading towards the latter half of 2022. But it's been a good year thus far. Thank you all for your good work and time spent here. And I wish you all a restful couple of weeks. And we'll see you back in these chambers on July the 12th, 9:30, bright and early. Thanks. We're adjourned.